Hello, welcome everyone, and thank you for joining us virtually as a part of the Iowa Medicaid Competency-Based Training Series for Long-Term Support Services. This training was recorded on June 16th, 2022, and will be maintained on the DHS website as a free training available to LTSS agencies and direct support professionals. This training series was developed to expand knowledge and skills in order to more effectively work with individuals served in long-term support services. Iowa Medicaid is implementing competency-based training and technical assistance across the state to build positive outcomes for members and providers, understand state and federal regulations, and increase access to training for direct support professionals. Please feel free to complete this pre-test to allow us to understand a baseline of knowledge in this topic area. To receive a certificate of completion for this training, you must complete the competency-based test at the end of the training through the link or the QR code provided. We also welcome feedback to this training and training process through a post-session survey that will also be available at the end of this training. Today, we have Stacy Lane, board certified behavior analyst and master's level social worker, to introduce us to positive approaches to challenging behavior. Stacy has over 30 years experience, and we are so happy to have her here today. Why don't you tell us a little bit about yourself, Stacy?
Hello, how's everybody doing today? I'm happy to be here. I'm glad that we had this experience being able to partner with DHS and the Eastern Iowa region, along with the Money Follows the Person program. I am a behavior support consultant and a board certified behavior analyst, and I've worked with people with challenging behaviors for over 30 years. I stop at 30 years and don't go past that because that really shows my age, as I am getting a lot older, but we'll just leave it as over 30 years of experience. Most of my experience has been working in the community with individuals, and for 16 of those years, I've worked at all different levels of provider agencies. And I think that has really helped me with conducting this training because I really do understand and I really do get the challenges and difficulties of working with individuals with challenges in the community. So as far as being short-staffed, just trying to get staff in there to do the job is very, very challenging. So I feel like that's really helped me in this job and trying to teach and help others how to work with some of those challenging behaviors. I am also a certified safety care instructor, which is more of a reactive approach to working with behaviors. It's more of the crisis intervention when things go wrong. So that's one thing to point out with this training, is we will be talking about all the things that we do proactively to try to help change behaviors to prevent crises from happening. However, also doing crisis intervention training is also something that is extremely important and helpful for staff to feel safe and confident in their job. So we'll talk about that a little bit throughout the day too, but most of today we'll be discussing those proactive strategies. So I want to start with, you have a binder in front of you. That binder is yours to keep. You can take notes on it, write in it, do whatever. We do have all of these forms and information online. So if you wanted to get clean copies of them, you could certainly download them and have them for your own personal use. So I want to go over the binder today so that you have an idea of how we're going to be using the binder. So in section 1 is just my contact information. If you have any questions about this training, any questions about any clients you're working with or whatever, feel free to give me a call. I'm always willing to chat about what's going on. Page 2 is just an outline of the training. Page 3 is just an overview of what today is going to look like. In section 2, actually, I believe it's section 2 and section 3, we have just a lot of information as far as the things that are going to come out of my mouth during this training today, excluding anything that I probably shouldn't say or swear words that I might use, because that happens occasionally. That is not in written form, but that is just all information, so you don't have to take a ton of notes and try to catch things as we're talking about it. Section 4 are a lot of the forms that we're going to use throughout this training today. So as we go through this training, I will be asking you to think about someone that you work with or someone in your life that you've had challenges with, and we're going to use that individual as a case example. Today is really going to be about the process that we need to go through to find out why behaviors occur so that we can put supports in place to try to change that behavior. And so we are going to use your own case examples today to work through some of those forms and some of those processes. So under section 4, those are some of the forms that we're going to use as we work through how do we look at changing some of those behaviors. Section 5 is there's some additional forms that we're not necessarily going to use all of those, but we may use some. The rest are just for your own information, your own use, if you find them helpful or beneficial. Section 6 is a glossary of terms. We all like to use a lot of big words and a lot of acronyms, and oftentimes we don't know what each other is talking about. So we put a glossary of terms in the back. Certainly do not, if I say something that you don't understand, please don't go back to the glossary and start looking it up. Just raise your hand or just type in the chat or do whatever and ask me what I'm talking about and what I mean. Because if you have that question, everybody else probably does too. So then we can talk about that. In the very back of your binder, there is just some information on language that we use when we are either speaking or writing when we're talking about individuals that we work with. And I am a very big stickler, I guess, and proponent of being very careful about how we say things and how we talk about people. We are really good at separating the people that we work with from ourselves just by the words that we say. And so we'll talk about that throughout the day. I do have some trigger words that I'm sure you guys will hear and find out throughout the day about how we use some of those words for other people, but we don't necessarily ourselves. So the information in the back of the binder is just some information, a reminder, just to be careful about how you use our language and words. In the front of the binder, which I guess I forgot to talk about, is an actual PowerPoint for you guys. It's of all the slides that we're going to be going over today. There's also a map of the transition specialist area. When we talk about transition specialist area, part of this training, and the reason we have the opportunity to do this is because of the Money Follows the Person training. The Money Follows the Person, some of you may or may not have heard of, is a federal grant that the state of Iowa received to assist with moving people out of institutions or intermediate care facilities into the community. Iowa received this grant because we are one of the states that still has the largest population of people living in institutions. And so this program is to help move people out and help them move to communities of their choice, and get the supports that they need in the community so they don't have to live in an institution type setting. Some of the benefits of this program are that you have a transition specialist who is kind of like a case manager. However, this transition specialist can do a little more than what a case manager can do. They're extremely involved in that person's programming and their transition into the community. People in this program have access to behavioral supports, which is why I'm here. Providers who are working with some of these individuals have access to additional support as far as behavioral training and behavioral programs, as well as things like helping people secure the things that they need for their own apartments when they first move out. A lot of people don't have anything when they first move into the community, so they may need help with furnishings and that type of thing. So it is kind of an enhanced program for some of those individuals who may have a harder time being successful in the community, to try to support them in doing that if they want to do that. So this is just a map with contact information. There is also additional information about what the Money Follows a Person program is in the binder, as well as online if people are curious about what that is. So that is the binder. The other things that we're going to be talking about today is one, just positive behavioral supports and what that means. A lot of you have probably heard the term positive behavioral supports. I think that's thrown around pretty loosely in our communities, and positive behavioral supports and how I think about it is probably not the same as what you may have heard of positive behavioral supports in like school settings or in other environments. So we'll talk about what that means to me, not necessarily what that means overall, and really we'll be talking more about applied behavior analysis. So we will also then talk about antecedent strategies and just what everybody needs to be successful in their life. We'll talk about behavioral assessments. What does a hypothesized function mean and why is that important? How do we match supports with a function? And then we'll end the day with my favorite part, which is preventing challenging behaviors by enhancing quality of life. Really, if you have a high quality of life and you have your needs met and your wants met, there really isn't any reason to have challenging behavior. So we'll talk about that and how that can be helpful for us in helping some of the people we provide services to. So we are going to start with common practice or traditional discipline versus positive behavioral supports. A lot of us have been raised on, well, I guess depending on the ages of some of you in the room, I would say a lot of us my age have been raised on traditional discipline, which may include things like being grounded, spanking, having things taken away. And that's become a very normal part of our life and has kind of trickled its way into how we work with and how we support other people. Positive behavioral supports, on the other hand, is just a different way to work with individuals to help them to change their own behavior. So my first goal of this day is to try to convince you that the positive behavioral supports is a much more respectful, positive way to help support someone with changing their own behaviors, because we are very used to traditional discipline. So we're just going to talk about that. And if you disagree with me on some of these things, I think that is perfectly okay. And I really hope that you will speak up and we can talk about those differences or those concerns, because I don't have all the answers. So we all learn these things together. Every time I teach this class, I learn something new from the audience. So it's hopefully all of us just learning and working through this together. So with traditional discipline, our goal is we focused on the topography of problem behavior. So we'll just throw a big word out right away, right there. Topography is basically just what is the behavior. It is the person hitting, kicking, biting, pulling hair, running down the street. Just what does it look like? What does that behavior look like? With positive behavioral supports, we look at what is the cause of that problem behavior. So I don't care which topography it is, if they're hitting, kicking, biting, screaming, whatever it is, it's a problem for that person. So what is causing that problem is the most important question for me. In traditional discipline, we look at eliminating inappropriate behavior. Well, that makes perfect sense, right? We want to get rid of that behavior that we don't want to see. Well, with positive behavioral supports, instead of looking at the inappropriate behavior, we look at increasing appropriate behavior and responses that are adaptive for that person. So if you think about this, really our goal is we traditionally spend a lot of time running around looking for, paying attention to when somebody's doing something wrong. I do this, find myself doing this frequently with my son, who has several disabilities, and I always know he has oppositional defiant disorder. So I always know he's doing something he shouldn't be doing, and I just got to figure out what it is. And so I'm always heightened on edge, watching and waiting and looking for what is it that he is doing or has done wrong. That's not a very pleasant way to live for myself or for him. And I'm sure some of you have experienced this before in your jobs. You're just waiting. You know that so-and-so Joe did something. What is it that he did? With positive behavioral supports, instead of spending all of our focus on that negative or inappropriate behavior, we're going to put all of our attention and all of our focus on the appropriate and adaptive responses. So it's like a teeter-totter. Instead of the behaviors we don't want to see getting all the attention. We're going to start giving attention to all those behaviors that we want to see. So as we increase the behaviors that we want to see, we should see those behaviors we don't want to see decrease. So with traditional discipline, our goal is to stop problem behavior by using random rewards or punishment. And with positive behavioral supports, we want to reduce our reinforcement for that problem behavior, which is what we just talked about, and provide reinforcement for the things that we want to see. So traditionally, I'm sure many of you have used rewards and punishment before, which is not calling anybody out, not saying anybody did anything wrong. That is just how a lot of us were raised and how a lot of us do things. However, there are a lot of negative consequences with using random rewards and punishment, which we'll talk about throughout today, that don't really teach an individual how to manage their own behaviors. So here's just a cartoon for you. I like cartoons, I like videos, I like stories. I think they're funny. So in this cartoon, it's just explaining and showing, well, for one, it's kind of scary how we can program people to be scared of or enjoy or whatever for the rest of their lives, which is really scary. So that's part of the reason why some of these things are so important, is we really can do damage to somebody by the interventions that we're putting into place. And so we need to make sure that the interventions we're putting in place are going to produce the outcome that we want. So in this example, it just shows a kid playing with an airplane and just various toys on the ground. And the experiment was they wanted to try to scare this kid out of ever riding a motorcycle or engaging in dangerous activities in the future. So every time that he would go near the motorcycle, they would blare a really loud siren and scare the crap out of the kid so that in the future he would not go towards dangerous activities. This is a practice that has been used and still used and can be used in behavior analysis, which is a stimulus response that can program people for the future. So it's a funny cartoon. However, at the same time, it can have very serious consequences to this kid, different kids, or some of the individuals that we're working with. So in traditional discipline, we see problem behavior as a problem. So that makes sense. If someone is having behaviors that we don't want them to have, it's a problem. Makes sense to me. However, with positive behavioral supports, we're going to see problem or destructive behavior as communication and or a lack of skills. So if we look at behavior as communication and or lack of skills, then what does our job become? Our job then becomes teaching communication and or teaching skills. When we're seeing problem behavior as a problem, that really, and we're using random rewards and punishment, that doesn't make any sense. So if we think someone is lacking communication and or skills, random rewards and punishment are not going to do anything for that person or teach that person anything, when our job then becomes teaching communication and or lack of skills. So with traditional discipline, I'm sure most of you have heard the term or heard the word behavior modification, behavior mod. It's been around for a really long time. It's been out there for a really long time. And I'm not going to say that behavior modification doesn't work or that there's something wrong with it. What I do believe, and I'm going to tell you, is that using applied behavior analysis is a much more effective, humanistic, positive, respectful approach to assisting someone with managing and changing their own behaviors. It is a scientifically valid approach to changing behavior. So you can research, you can look up the articles if you're interested in what applied behavior analysis means. However, applied behavior analysis is basically what we will be talking about for the rest of today. So whether we call it positive behavioral supports, applied behavior analysis, we really will be diving into why behaviors occur, How do we change those behaviors? What are people getting out of those behaviors to replace it with more functional ways to get an individual's needs met? With traditional discipline, we are really an observer or object of offensive acts and a police officer problem behavior. This kind of goes back to like us running around just looking, waiting for this person. You know, we know that they've done this 100 times and we know that they've done something and we're just going to find it. Instead of with positive behavioral supports, we're going to look at what's going on in the environment. What in the environment is influencing this person to contribute to some of this behavior. So we're going to look at those environmental influences and then become a provider of preferred possibilities. That sounds to me a lot more fun than always running around wondering, what is Joe doing? What kind of troubles is he getting into now? Instead, I'm going to look at what's contributing to that behavior and how can I assist Joe with getting what it is that he wants or getting his needs met without having to have those interfering or problem behaviors. So with applied behavior analysis, we ask, why do behaviors occur? And behaviors that occur behaviors that persist serve some function. So meaning any behaviors that you see that are occurring over and over and over again means that the person is getting something out of having that behavior. And until we find out what that person is getting out of having that behavior, any interventions that we're going to throw at that behavior are most likely not going to work. So I'm sure many of you have experienced, you know, you're at work and you have an individual that's having behaviors over and over. So what do? We have a big team meeting and we start talking about what can we do to try to change this behavior, and people start throwing out strategies or things that have worked for them in the past. Well, I use this with Jim and this really worked, or I use this with Amy and it was really successful. However, we don't take the time often to go through the process, which it is a process, which is what we're going to be talking about today. And some of you will get really frustrated with me because you'll want to say, what if, and you're going to hear me say, we're not there yet. Until we know what that function is, we are not going to be able to put the right support in place to change that behavior. And that's why oftentimes we fail at changing behavior, is because we throw different interventions at it without taking time to find out why that person's having that behavior. Then and only then can we put a support into place to try to help that person change that behavior. So we'll be talking about function for the rest of the day. We will, by lunchtime, I'm sure all of you will want to throw something at me because I am continuing to say we're not there yet. Write those questions down. We will talk about them this afternoon, but we need to get through some of this information before we can really start talking about interventions and what we can put in place for some of the challenging behaviors. Okay, so hopefully at this point, everybody is on the same page. And if not, please feel free to ask questions, raise your hand, argue with me, whatever it might be. I'm perfectly okay with that. As far as hoping and believing that what we are going to be talking about, which is positive behavioral supports and applied behavior analysis, is a much more humane and effective way to work with individuals with challenging behaviors. So the first thing that I do when someone is having a problem or someone calls me and says that they need help with someone with a challenging behavior is I want to make sure that, first of all of that individual's basic supports are met to the best of our ability. So a lot of this section might sound like it's very much common sense to you. It might just be a reminder for some things that we need to think about. However, I've learned over the years that, first of all, common sense is really not that common. And second of all, it's those little things, those small things that mean the most to most people and are often the things that we forget. And so we're going to go ahead and talk through what some of those things are. So first of all, I want to talk about it says antecedent strategies and basic support needed. And when we talk about antecedent strategies are strategies that we are going to do ahead of time prior to, always just for this individual to try to help them be successful. They're going to talk about later, we're going to talk about consequence strategies, where it's what do we do after a behavior occurs. So these are antecedent strategies that what are we always going to think about? What are we always going to do ahead of time to try to help this person be successful? And one of the first things I always think about are medical concerns. I can't tell you how many people I've worked with who have had a lot of really challenging behaviors because they had something going on medically that we weren't aware of. Probably the most scared that I've ever been in this job was when I was working with an individual who had autism, and he was in his mid-20s, and he was about 6 foot tall and probably weighed a little over, 250. And he was constipated and was not able to tell me, and he was trying to get me to understand that he was not okay and something was going on. And I almost got my nose bit off my face that day. It's because I didn't know what he was trying to tell me, and I didn't know what was wrong. And he really honestly was coming at my face with his mouth open, and I couldn't hold him off of me. Because he was that upset and uncomfortable. And that was a pretty scary situation. I definitely was having flashes and seeing and thinking that I was going to have plastic surgery on my nose, but that didn't happen. There were other people there to help me, so that was really good. But medical concerns can be huge, especially when people can't tell us what's wrong or what's going on. You look at constipation is huge for a lot of people we work with because of all the medications that they're on. Urinary tract infections can be really bad for people and can really mess with people, as far as how they're thinking and just having horrible infections. Some of the other things I think about, though, are some of the things that aren't as obvious. Well, not that they're obvious, but we don't think about as much as we might think about a headache or a stomach ache or things like that. But what about things like, the population that we work with is living longer and longer. And as they live longer, we're starting to see things like people may start to lose their hearing, may start to lose their eyesight. As someone who's getting older and experiencing some of those things now at times, that can be very frustrating. And if the person is not able to tell us what's happening, and let's say, for example, they're starting to not hear as well as other times, and we are asking people to do things and they're not doing them, think about that frustration of we may be frustrated because we think they're being non-compliant, which, by the way, is one of my trigger words, non-compliance, whatever that means. And really the person couldn't hear us. Or eyesight, and how scary that is to start to lose your eyesight. I never wore glasses at all. No eye concerns whatsoever until I turned 40 years old and I ended up with trifocals, just like that. So those are just things that we need to think about, especially when people can't tell us what's going on. Another thing that I like to think about is a person's diagnosis. I don't like to label people necessarily. Unfortunately, it is the world that we live in, that if you don't have the right diagnosis, then you don't get certain supports. And that is how people get services, is by having a certain diagnosis. However, what that diagnosis, for me, what I want people to think about is, what does that diagnosis mean for that person? So, for example, if you're working with someone with autism, you're going to have certain things that you're going to want to think about, certain considerations that you need to think about when working with that person in order to help them live a successful life. Some of those things may be things like a schedule, and a picture schedule versus a written schedule. Things like sensory defensiveness, which we'll talk about in a little bit. Things like them knowing what they're going to do throughout their day, and does it need to be a very structured environment for them. versus someone, for example, who will take my son, for example, who has oppositional defiant disorder. We're going to have completely different considerations for someone with oppositional defiant disorder as what we're going to for someone with autism. Someone with oppositional defiant disorder, I need to make sure that I know how to use my words very carefully, not say the word no, try to help my son think that everything that we do, everything I want him to do is his idea. So it is a very different world than working with someone with autism. And traditionally, what I have seen at times is we work with people all the same across the board. And that can cause us a lot of problems if we're not taking care of and looking at those specific things that we need to consider for that diagnosis. So you're definitely not going to work with someone with oppositional defiant disorder the same as you're going to work with someone with autism, and vice versa, or you're going to end up with a lot of behaviors happening and going on. So again, when I talk about the diagnosis, that doesn't mean that everybody with autism has sensory processing issues or has to have a structured routine or a picture schedule. It just means there's things you need to think about. And I like to tell people, if you've met one person with autism, you've met one person with autism. Everybody's different. There are just different things that you need to consider. A person's past life events. A person's past life events are definitely, we all have a past life. We have all gone through experiences in our lifetime that have created who we are today. It's kind of the hand that we've been dealt in life. We're all who we are for various different reasons. It's not any different than from the people that you're working with. They all have past lives. They all have had different events happen in their life, whether it is their parents are divorced, or there was substance abuse in their family or the history, or they've been institutionalized, there may be abuse in their past. All of those things have made them who they are today. And when you talk about abuse, when you're talking about people with disabilities, the statistics are really scary. At one point in time, 83%, the statistics were that 83% of people with disabilities have been abused at some point in their lifetime. I am certainly hoping that that statistic is changing with more awareness. At the time, however, of those 83% who had been abused in their lifetime, they had been abused 10 times or more. So when we think about why behaviors occur, that makes sense, right? With all the things that potentially some of the people that we work with have gone through. It's just like any of us who have gone through challenges in our history, in our life, is not any different than the individuals that you're providing services to. So I'm not in any way suggesting that any of you need to try to be therapists or act as a therapist to the individuals you're working with, unless of course you're qualified to do so. However, I think just understanding a person's history and understanding a person's past can really help you to empathize with that person, to not take things personally. It can help with the way you work with that person, and try to help provide supports to that person, because it does give you more context into why a person is having the behaviors that they're having. Sensory integration and defensiveness, that is something that we're going to talk more in length about in a little bit. So we will come back to that. So we will go ahead and move on to some environmental considerations.
Behaviors don't happen in a vacuum. How I behave and the things that I'm doing right now is affecting how you guys are responding to me. How you guys respond to me is going to affect the things that I do standing up here and talking about this information. Right? Your interactions, your tone, your body language, the rate at which you speak, the volume at which you speak affects the people that you work with. This is one of those things that is so hard as supervisors because you're not always there. And so sometimes you can't see it, you can't hear it. And you can get an incident report that says, I did this and this and this, and this is how this person responded, but it doesn't include your body language and that person's tone and all of those things, right? which could be making or breaking whatever's happening within that relationship. You can take a simple question and make it sound like a demand, right? And you can't see that on a piece of paper. Can't read that. So a lot of times this is where we have to take a step back and look at ourselves. What am I doing? How am I coming across? What did I say? What was my tone like? What was my body language like? Did that contribute to whatever's going on in the situation? A lot of times it is. Sometimes it's not, but that is really hard as supervisors to determine if that's really going on when you're not there all the time, but it's definitely something you need to consider. I used to have people call me all the time, Stacy, what do I do when Joe hits me? I don't know. Say, ow, run away, he hit you. I don't know what to tell you. The real question is why did he want to hit you? What did you do that made him want to hit you? Right? There's something else going on there. So I think there's one more. Okay, so we'll talk a lot today about changing staff responses and our own responses versus focusing on changing that other person, because my behavior affects yours and your behavior affects mine. So if I change my behavior, that is going to have an effect on the person that I'm working with. Make sense? All right. Oh boy, rights restrictions is huge. We could spend an entire day talking about rights restrictions. We won't, I promise, but rights restrictions can go either way. Sometimes, for some people, there are too many rights restrictions in place, and that causes problems for people, right? Can you guys think of what some of those might be? Right, perfect, right to choose your roommate. What else?
Having a payee.
Having a payee, it's my money, right?
Medication management.
I don't want to take these meds, they make me feel funny.
The time I want to wake up in the morning.
Ooh, we're gonna get into that this afternoon. You guys are not gonna like me much. Yeah. Definitely, yeah.
Having the right to everywhere in the home.
Yes, right to everything in your home and everywhere.
The right to sexual orientation. The right to sexual orientation.
Absolutely, right to sexual orientation, or even sexuality, period. Right? It's a huge one.
I guess something like that, how would you define, because so we have an individual that was molested from the age of 6 to 9 by his father. He's 24 now, and he chooses to use inanimate objects, not as objects used for that. So he'll stick them anally,
Mhm.
and it starts to become an issue because going through something, he hurt himself. It's so stimulating in his mind where he has to do it because that's how he behavior, that's how he's.
Yep. Yep.
Getting him not to do it is typical person using the toys to do it, but he chooses not to. He'll go take a iron rod or a shower rod or something used and trying to keep from that.
Mhm. That was gonna be my first suggestion, is take him to the sex store.
Oh, he has a treasure box inside of his toys. He's
That's
done.
great, that's great.
He doesn't use, he doesn't.
Yeah. Yeah, that is a tough one. I mean, that is definitely, that's the other thing with a lot of these things we talk about. One of the recommendations would typically be get them into therapy, right? How does talk therapy work for people? I'm not saying it doesn't, but I'm saying there are times when talk therapy doesn't even work for people without any type of intellectual disability or any disabilities. And probably even less so for some people with disabilities. It might not help everyone together, right? It just complicates the matter, makes things a lot more challenging. I mean, clearly I can't answer that. I mean, we can talk about in a little bit some things that may be able to try, but you've probably already tried them. That's just something that's gonna be really challenging. If you're providing what you need to provide and you've had those conversations with them, the best thing you can do in that situation is try to keep them as safe as possible. Yeah, those are some serious tough situations. What other rights restrictions?
Having a guardian,
Having a guardian, yep, and tell me what to do. What else?
right to vote.
Right to vote. Well, people have the right to vote, but sometimes we don't want, technically. Right to consume alcohol.
Food restrictions.
Food restrictions. Going to a bar, going to the strip club, right? So I worked with an agency once that they were adamant that this guy could not go to a strip club. And I'm like, well, he's 18, right? Yeah. So what's the problem? That's just not right. I mean, why is it not right? Well, they couldn't answer me. Well, then it came to, well, the staff don't want to do that. I don't care what the staff want to do. They're getting paid. Hello? You're getting paid to do a job. Okay, if you are really that uncomfortable, okay, fine. Find another staff to do it, right? Find somebody else who's willing to do it and take them to the strip club. I mean, we fought for probably, okay, exaggerating, an hour during a class one time over that. It's your job. They want to do that. You're of age. It's not illegal, right? Not saying I haven't ordered on illegal things before. Oh, that's gonna edit out too, right? We've had some people who've tried to get us to get them strippers or get them, prostitutes, come to their homes. I had a staff tell me, well, can I pick up the phone and call for him because he didn't have the physical ability to do it? And I'm like, no, it's Medicaid money. No, it's illegal. Medicaid money. Help him find a friend who will come do it for him. As a paid staff, you're not going to do this. You can put that on the DHS website. Protecting Medicaid money. I'm seriously not gonna have a job after this. Okay, so we have the whole rights restrictions thing, okay? So we've talked about this extreme where we have rights restrictions in place that don't make sense, right? For people, may not make sense for people. And it's not because we want to be mean, it's because we're trying to protect people, right? Trying to protect people, keep people safe, which makes complete sense. We then have the complete opposite extreme of we don't have enough rights restrictions in place, okay? This is what I run into most often now, is where there should maybe be some restrictions in place, which sounds completely counterintuitive to HCBS waiver services, right? Because it's their right, they get to choose. However, let me explain. When you've lived in an institution for however long during your life, and you have been told every minute of every day what to do, what you were going to eat, when you were going to eat it, what activities you were going to do, and or if you have trauma in your past and in your history, sometimes your choices are too overwhelming. It's too much. I worked with a kid who, by the time he was 11, had been through more than I could ever imagine that an adult would have gone through. He had an abuse history. He had been in and out of several different institutions. He'd been in and out of the hospital. And this was when I was really young and I thought I knew what I was doing. Clearly I didn't. And they dropped this kid off on my doorstep at this agency. And I was like, see, people are telling me you can't serve this kid. Really? He's this blonde haired, blue eyed, cute little shit, dropped off on my doorstep. I'm like, come on, guys. So we said, okay, we'll provide services to him. So we get him a couple of roommates, right? Because that's what you do. Got to have roommates. Can't afford to provide one-to-one services, which is a systemic issue. And we start providing services to him, and we're doing all the usual things, right? What do you want to have for dinner? Where do you want to go today? What do you want to do? Do you want to go swimming? Do you want to do this? Whatever. And this kid wouldn't answer us. Would take off all the time, would take off on his bike and go riding around downtown Iowa City, which is not safe, by the way. He didn't have the skills to do that. So he's having behaviors all over. We're like, what the heck? We don't understand what's going on. So what do we do? What do you do when the people start having behaviors that you're working with and you don't know what else to do?
Sure.
Take things away, restrict, or we go to the hospital, right? We're gonna take him to the hospital because this kid's out of control. We don't know what's happening. Take him to the hospital. He's in the hospital for a couple of days and they say he's fine and they send him home. Sound familiar? Yeah. Comes home and things just, it escalates and continues again. Kid can't make choices. He doesn't know. He His anxiety is over the top. He starts hitting his roommates, starts breaking furniture, starts having all these concerns. Well, what do? Back to the hospital. Okay? Go back to the hospital. We don't know what you people are doing, but there's nothing wrong with this kid. He goes to the hospital and is perfectly fine. It got to the point where we started to have parents and guardians complain because he was hitting their children. It turned into kind of a disaster and we had to end up discharging him, right? Which was one of the hardest, well, actually wasn't a decision I made, but I can tell the story now without crying, so that's good. What I realized too late was we had basically taken this kid from a very structured environment where he felt safe and put him at 11 years old into this home with a bunch of strangers and other children without any structure in place. We would ask him what he wanted for lunch. That kid had no idea, no clue. He couldn't make a simple choice. He was never given choices. He didn't know how to make a choice, right? What happens if you give a kid the choice between a hamburger and a hot dog? Think about his history, think about things he's gone through. You want a hamburger or a hot dog for lunch? If he chooses the hamburger, what happens to the hot dog? It's gone. Goes away, right? Oh my God, I can't make this choice. If I choose the hamburger, I may never have a hot dog again. Are they ever going to give me that choice to have a hot dog again? Oh my God. Simple choice between a hamburger and a hot dog. Those are the times where sometimes we need to have more restrictions in place to begin with while we teach people how to make choices. I run into, well, writing behavior plans. I run into providers a lot who say, we can't do that. It's HCBS. Yes, you can. Yes, you can. You need the team's approval and you need to have a way that you are working towards removing those restrictions. But yes, you can. So for someone like that kid, had we had a hospital type environment for him to start with, we could have brought down his anxiety level, calmed him down, and then gradually started introducing different choices for him and teaching him how to make choices. Reassuring him if he chose the hamburger, the next day he could choose a hot dog, right? Instead of bombarding him, it's like turning a kid loose in a candy store. It's just too much. I see that happen frequently with people who are coming out of institutions who've been there for a long time, who have behavioral type issues. Other people, great. Other people, they transition out. Oh my gosh, I'm free. You can make all these choices and it's great. But for some people, that's really hard to do. So you have to think about those things. Does that make sense? I know it sounds completely counterintuitive, but you're still working towards removing those restrictions. But sometimes you just can't do it all at once. Schedules and routines. How many of you have a schedule and a routine? I do. How many of you get stressed out if your schedule or routine changes? As I'm looking at a room full of people who provide services. Our routines change all the time, guys. Come on.
It does, it's still stressful.
True, that's true. That's true. How many of you use some type of schedule?
Try.
Like whether it's a book, you know, planner, or some of the planners are like per day, some are like per week, some are like whatever. Mine is, oh gosh, panic attack, I lost it. No, it's right here. My schedule's on here, and if I didn't have this, I'd be lost. I wouldn't be where I was supposed to be. And I wouldn't be able to find out where I was supposed to be or call anybody because all the phone numbers are in here. Right? That's what happened. I'm lost and no phone. That's bad news. We all use some type of schedule, right? And we all use something different. We use whatever works for us. No different than the people that you work with. Some of the people you work with need to have schedules to know what their day is going to look like. Right? It doesn't always mean this complicated picture schedule where you got to print out a picture, you got to laminate it, you got to put Velcro on the back, you got to stick it to some kind of binder thing, and then everything falls out when you want to use it anyway. Right? Does that sound familiar? Doesn't necessarily mean that. All schedule routines mean is how are you going to let the people that you work with, and or how are they going to let you know what they want their day to look like? That decreases anxiety, which decreases behaviors, right? You need to know what to expect, you need to know what's coming up. Sometimes it is that ridiculous binder with all the little pictures in it, and you never need to have the one that you need to begin with, but whatever. Technology is a great thing, much better now. It's just letting people know what their day's gonna look like. So they're not stressed about that. I get very anxious if I don't know what my day's gonna look like. You guys? Yes? That's why we start with, here's the breaks, here's the lunch, here's the bathroom, here's the vending machine. Right? I don't want you guys sitting here being anxious. Next slide. So then we need to talk about if we think we have most of the basic support needs met. There are still gonna be, some of us have triggers, antecedents, whatever you wanna call them. I don't care what you wanna call them, but they're basically events or situations that cause problems for us, right? Routinely cause problems for us. People we work with have triggers. My watch keeps thinking I'm working out. How funny is that? Can you guys tell I really never work out because I'm pacing and it thinks I'm working out? That's funny. That's sad. Oh my, that's sad. Okay. Anyway, triggers. Exercising, not gonna do it. The people you work with have triggers, right? And all of you guys have triggers. So let's talk about what some of your guys' triggers are. Just be honest, it's okay. We're all friends here, right? What?
Loud voices.
Loud voices. Am I freaking you out? I'm trying to yell at
I guess I
this.
shouldn't yell.
When people waste things, excessively use things.
Oh, yeah, yep. Okay,
People eating.
people eating, as in the noises? Yeah. Right, yeah, mouth noises. I don't like that either. I don't think I'll go to lunch with any of you. I'm kidding, we're going for a
Being
steak.
touched without permission.
Touch without permission.
Yeah,
Yep,
like, don't touch it, so.
good.
Squishy things or like wet things.
Okay, good. You wouldn't like to slime in my office, then?
Yeah.
No. Small talk, you know, like small talk. Yeah. What do you think?
Mine is, it's not really my work, it's more when I come home. I have to have things, I need 30 minutes to not, just to be left alone. Just to plus things. And
Yeah.
it's like, I have to have a certain sense of cleanliness or order,
Mhm.
just, and then I'm good, then I'm like, good.
Good.
I've been that way for years.
Yeah, perfect. Okay. What else?
Crowded stores.
Oh.
Leave the off an aisle for like 2 minutes looking at the shelf.
Yep, crowded stores. Oh my God. So my two biggest triggers, which is one of them you just hit on. My two biggest triggers are shopping in Walmart on Saturday. Stacy's not gonna do that. You're not gonna find me there. You probably won't find me at Walmart, period. Definitely not on Saturday. The second one is tornadoes. Terrified. Terrified of storms and tornadoes. So
We
what
have-
do we do?
We have some online shares that I feel like
Oh, perfect.
yeah.
Sorry, yes.
That's
absolutely.
okay. The scratching sound in the ceiling at work that I have no idea what it is.
That's Ashley.
Yes, that's actually.
Right.
And then people not listening or not feeling heard probably.
Well, that's
too.
not Ashley, is it? Or she's-
No,
okay, thank
no.
you.
That's Molly.
Perfect. Okay. So you think about the triggers that we just said, right? So now think about the triggers of the people that you work with. They have all the same triggers you just listed. What other triggers do they have in addition to what we have to deal with? What? Oh, okay. Yeah, you're right. Like what?
Trauma.
Trauma.
Probably even around people.
Being around people all day. These staff in and out of my house, and I don't like this one, and I really don't like that one, and this one does this one that irritates me, and this one will leave me alone, right? Day programs, housemates,
Having to leave the house when you don't want to,
having to leave the house when you don't want to. Why? Why do they have to leave the house when they don't want to?
because they have to go to the day program. or
Oh,
they have
we're
to
gonna
go
have
to
fun
a
this afternoon,
outing, or
guys.
they- Yeah.
You're not allowed to be lazy.
Not allowed to be lazy or retire,
Again.
Yeah.
or retire. Heck no, can't do that.
So, of course.
Yeah, exactly.
Being told what to do.
Being told what to do. Yeah, you don't tell me what to do. Nope, that'd be bad news again. Then we wonder why behaviors occur, right? So first of all, when it comes to triggers, antecedents, whatever you want to call it for people, the first thing that we need to do is first we need to find out what those are for people, right? We need to know what their triggers are. How many of you know what the triggers are for people you work with? Some, maybe not all. Yeah. Then what we need to do is if we can remove a trigger from that person's environment, and that person's life, let's remove it. Right? Stacy does not go to Walmart on Saturdays. I am not going to put myself through that. I just remove it. Online shopping is a wonderful thing. Oh my God, I love it. I pull up, they put it in my car, I drive away. It's great. Awesome. When there are things that we can't control and we can't remove, such as if there's a tornado coming towards my house, there's nothing I can do about that, right? Can't remove that threat. By the way, so what we should do is try to help people to better cope with that trigger when it does happen, right? So we teach people coping skills or whatever it is, or for people to know when that trigger might be present or might happen, to talk about how you respond when that happens and prepare ahead of time for it, right? That's what we should be doing with people. Prevent it if we can, help them cope with it if they can't. Unfortunately, no one in my life has ever been able to get me to cope with storms and tornadoes. Say that straight up. I lose all logic whatsoever, which we're gonna talk about that too. As we get stressed, we lose skills. I pace around the house, I look out the windows, I get clothes and bike helmets and shoes and blankets and my kid's medicine, because if that got blown away in a tornado and he didn't have his meds, that'd be tragic. Make everybody go to the basement. I mean, I like freak out. I just don't make any sense. So what my family used to do is walk around handing me Bud Lights and cigarettes. That used to calm me down a little bit. But I quit smoking. I don't drink that much anymore. Yes, I know, surprise to some of you, but anyways. If anybody wants to write a behavior plan for me or surrounding tornadoes, please do. That would be great. Be great. So once we can identify what those triggers are, once we know what the triggers are, what the antecedents are, that makes behaviors highly predictable, right? Because we know if this antecedent happens, this behavior is going to happen. So that allows you to be prepared. That allows you to have a plan. That allows you to be able to help that person through that situation the most that you can. Other triggers for people, specifically moving out of institutions and into the community, is, I mean, transitions are really hard for people, right? Transitions are really hard. How many of you have moved? I just moved. Oh, terrible. I just moved. Is that a pleasant thing to do? Oh my God, no. How many of you have had behaviors when you moved before? Yeah, still in an argument as we speak. Because of moving. Over nothing, because people are stressed, right? Moving is stressful. So when we are attempting to move people into less restrictive settings, which is what we should be doing, we have to think about, this person is moving into an environment that they've never been in before, most likely. They're moving into possibly with roommates that they might have met at McDonald's for, half an hour, 4 Saturdays ago. And they're getting all new staff that they don't know, right? Think about that. And they're getting staff they don't know who may be assisting them with some very personal, interpersonal type things that are not, you wouldn't certainly know that stuff wouldn't be happening. Think about that. And then we wonder, well, why are these things happening? So we have to be patient with people, be very patient with people when they're moving. Apparently I'm done working out. So we should, on one hand, expect the behaviors are going to happen when people move, right? Because there's a lot of stressors. However, sometimes the exact opposite happens, and there's a honeymoon period, and people are great for the first 3 to 6 months, and then everything falls apart. So you've got to watch out for that too. I've written behavior plans for people, and they moved, and the staff said, well, we didn't need this plan. Everything's going great. 6 months later, I get a phone call. Oh my God, he's freaking out. I don't know what to do. Are you following the plan? No, we didn't need to. Well, apparently we did. Or things wouldn't be where they're at right now. So you have to be careful. Sometimes that happens. Remember that behavior change takes time. Behaviors that we have and the behaviors that the people that you're working with have developed over a long period of time. You're not going to change it in a couple of days. You're not going to change it in a week. It's going to take months. And there is no cookie cutter approach that you're going to throw at this behavior that's going to work, and it's going to work like magic. It's not going to happen. Behaviors take a long time to change. For some people, when people are moving, we have to watch out for certain rules being established in the first few days. So sometimes when people move out, organizations may, think, okay, this person's moving in the first few days, they're not going to go to a day program, they're not going to go to work. We're just going to hang out and get to know them. We're going to go out to eat. We're going to go shopping, do all the things and make that transition smooth and whatever for that person, which is great. And some people that's perfectly okay for, right? For some people, however, you just created a routine for them. And that's what every day for the next however long is going to look for them. So now they expect 3 days later, we're not going to a day program, we're not going to work, we're going out to eat again, we're going shopping again, we're doing all these fun things that we've been doing for the last 3 days, right? So some people who are very rule oriented, you need to make sure that day one, when they move in, that routine established. For some people, right? Staff training. Clearly, I'm a huge proponent of staff training. This has been a huge push, at least it was initially, with money following the person. Is that all staff are trained before a person moves in? All staff are trained before a person moves in. I know.
I didn't know you was like that.
What's that?
I didn't know you was a comedian.
You picked up on that by now? No, I'm just kidding. I know this is hard, especially right now. Everybody is so short-staffed. But for people who have challenging behaviors, if your staff aren't trained when that person moves in, they're not going to last long. If they don't know what their triggers are and they don't know their baseline to know how they typically are versus when are they starting to get anxious, which versus when are they starting to get upset versus that staff doesn't stand a chance. And neither does that person in that environment, because what's going to happen? They're going to set off some type of escalation sometimes, right? And then that causes this whole chain reaction of how many of you dealt with that constant staff turnover? Out the door, out the door, out the door. I know it's easier said than done, and especially now. However, if you spend the money and the time and the energy up front, train your staff well to get staff invested, they're going to stay in that position and they know what they're doing so that we're not causing injuries and people aren't getting hurt, you're better off in the long run. You're going to stop that constant staff turnover. Yes, does that mean sometimes you're paying a lot more overtime? Because you have to have seasoned people covering while you're training new people? Yes, that is exactly what that means. However, the alternative of all those hidden costs of hiring and training and advertising costs just as much as those overtime costs. I'm telling you, overtime is just something that's easier to see. We pay more attention to it, right? But we're throwing money out the window when we don't train our staff and we get this constant turnover. Does that make sense? Okay. Okay, go ahead. We kind of talked about basic supports and what we need to do and think about as far as the basic supports for people that work with, right? So if you ensure that some of those basic supports are met for people the best of your ability, which sometimes, we can't, I get that. And a person is still having some type of behavior or concerns that we think we need to address, there are some questions that we need to ask ourselves. So the first question is this behavior destructive? Sorry. Yes, is the behavior destructive. So first of all, does this behavior need to change? Okay. I have seen people try to change behaviors before that really didn't need to change. Just because we think something might be weird or odd, or we think somebody maybe shouldn't be doing it. Says who? So we really need to think about, does this behavior need to change? So in order to determine if this behavior needs to change, we need to ask ourselves some questions, okay? So first, is it destructive behavior? So is this behavior dangerous to the person? Is it dangerous to others? And is it property destruction? What's wrong with those questions?
What do you consider dangerous?
What do you consider dangerous? Am I gonna consider something dangerous the same? I've done this for over 30 years, people with challenging behaviors. Is something gonna be the same kind of dangerous to me that it is for someone who's brand new to this field? No. No. Our perceptions are gonna be completely different, right? Those questions are very subjective, very subjective. So how dangerous is it? Is it dangerous to the person? So is there broken bones? Is hair getting pulled out? Is there open wounds? What level, severity, and frequency is that behavior happening, right? Is there property destruction? Well, what kind of property destruction? Is the person breaking their own stuff? Or are they breaking out windows and throwing refrigerators and stoves? Big difference, right? Throwing refrigerators and stoves is probably pretty dangerous. It is dangerous. Breaking window is pretty dangerous, right? Depending on how it's broken. Breaking my own stuff because I'm mad. My own stuff, right? Okay, whatever. So if you can answer yes to any of those questions, that it is dangerous to that person, or it is dangerous to others, or there is significant property destruction that's dangerous, you need to do something right away because somebody's going to get hurt. So you need to make sure that the staff who are working with that individual have some type of crisis prevention, crisis intervention, skills, training, supports, whatever it is to be able to handle that crisis. Okay. I know there has been a huge shift in our world with, we're not doing that type of training in a lot of places. A lot of people, what I hear is, if you have any type of crisis intervention training, no, we're hands off. What does that mean? What do you mean you're hands off? What I'm talking about is not necessarily hands on. Everything that we're talking about today is proactive, right? We're trying to figure out why behaviors are occurring, how to change those behaviors. However, this is not going to tell you what to do when someone is actively hitting, kicking, screaming, biting, trying to jump out a window, trying to start a fire, trying to whatever, it might chase you around Iowa City for 3 hours, which happened to me. I can't run that long anymore. I'm too old. I'm just going to be hurt. It's just dead. You've got to have some type of crisis intervention training. I don't care if that's CPI. I don't care if it's MANT. I don't care if it's safety care. I don't care if it's PIA. I don't care if it's UCARO. I don't care what it is. Your staff need the skills to be able to de-escalate somebody, to be able to protect themselves if somebody's coming after them, and to stay safe, period. That does not mean hands-on. That does not mean restraints. They still need those skills, okay? So I think people get confused when we talk about that. No, we don't do any of those things because we don't believe in that. It's not about hands-on. It's about giving your staff the skills they need to keep themselves safe and the people around that individual safe, and how to de-escalate situations. If these things are happening where it really is dangerous to the person, dangerous to others, and there's significant property destruction, that's a no. You have to have that training. That makes sense? If you say no to all of those, then you need to consider, okay, well, is this a problem behavior? So is this preventing the person from advancing to more independent opportunities that maybe they want? Okay. So maybe they want to spend more time in the community and do things out in the community. However, their behaviors are preventing them from doing so because when they're in the community, they do things that are inappropriate. I don't like that word either. I can't believe I just said it, but inappropriate. They're doing things that would get them in legal trouble. How about that? That then is probably a behavior that needs to change, right? Is a behavior disruption to the program. kind of like I explained to you guys before about the kiddo that I worked with who started hitting his roommates, and the parents and guardians got upset and didn't want to live with them anymore. That was a problem. Or is the behavior jeopardizing the person's placement? I'm gonna get on my soapbox here for a second. You guys will find out I have lots of those too. Jeopardizing the person's placement. What does that mean? If the person's home, where else do you think they're gonna go? If you moved them into that home and now we say we can't provide services to them, where are they gonna go? And then what? Reality, guys, is there no place for people to go anymore. We have to develop the skills and the ability to serve people in their homes. We have to put protections and mechanisms in place to keep people in their homes. Hospitals are full. Institutions aren't taking people, they're sending people out. Where do you think they're gonna go? There is no place to go. So reach out to somebody, get help, get support, figure out how can you keep that person in their home? Because you can take them to the hospital and drop them off. That's not gonna do any good. It's not gonna do that person any good. Not gonna do the hospital any good. They can't, we have people sitting in hallways in hospitals, guys. We don't want that happening to people. Oh, I'm hanging out in the hallway because I have behaviors and I got kicked out of my home. Come on. That's why we need to make sure the more education and training we can get out there to people and our staff, the better off people we're gonna be. Make sense? Okay. If you answer yes to one of those questions, you can go ahead to the next slide. Okay. If you answer yes to that next question, then we need to talk about and start considering doing a behavioral assessment. Okay. So this is classic. So Toby's bored, Dad's doing something boring, probably like watching the news or something. So Toby snorts. Dad says, dude, knock it off. That's annoying. So Toby snorts more. That classic.
Yeah.
Yeah. We do that all the time. Don't we? All the time. I'll come exercising again, guys. Just thought I'd keep it posted. Okay, you go to the next slide. When we're talking about starting to do a behavioral assessment, the first thing that we need to do is be able to define what that behavior is. Okay. Now, the reason that we're going to define what the behavior is because if we can't measure it and we can't observe it and we can't count it, then we are not going to know if the interventions that we're putting in place are working, right? Can't rely on our perceptions. We have to be able to measure it. So in order to measure it, we need to know if it's observable. We have an observer agreement. We have to all agree on what that behavior is that we're looking at. Okay. So go ahead to the next slide. What that means is we have to make sure that we're defining behaviors in a very objective behavioral terms. Okay. We're going to measure it. So up here, we do have some very non-behavioral terms or what are kind of emotional terms. So one of them is aggression. What does aggression mean? What is aggression? Okay, is aggression a behavioral statement, behavioral term?
I think so.
No. What could you say? I mean, aggression's not measurable because we don't, I mean, what is it? So we can't count it. You and I would probably say that have two different interpretations of what aggression are, right? How might you make that a behavioral definition? Combative. What's
Hitting.
combative mean?
Hitting people, Molly
Hitting
says,
people,
yelling at people.
yelling at people. Huh? Cussing?
Following up.
Maybe. Maybe cussing, because, you know, I sometimes cuss, I'm not being aggressive. Did you say?
I said like balling up your fist or clenching your teeth.
Perfect, good. Things you can see, right? What about non-compliant? I do not like this word. Non-compliant.
Am I supposed to be clicking when more things come up or is, okay,
No, you're good.
okay.
What might be a behavioral definition of non-compliant? Not taking meds. Not responding. Not responding, how?
Like the questions or just sitting.
So not stating or not answering the
Yeah.
question, okay? What did you say?
That's the same with non-compliant. Generally, if they have a history of complying or answering the questions, and now they are not.
Maybe, right, yeah. So you can use the word non-compliant, however, as long as you're defining it. So Joe was non-compliant in that I asked him to take his meds and he said no. Or he did not answer me, or he did not take them, or whatever, right? Tantrum. I don't like this one either. Might be screaming.
Throwing yourself on the floor.
Throwing yourself on the floor. Okay, you guys get where we're going with this? It has to be very, you have to be able to see it. I can't see tantrum. I don't know what that is. What does that mean? Okay, you can go ahead next. What you have on here are a list of statements. And what I want you to do is beside each statement, I want you to mark whether yes, it is a behavioral definition, or no, it's an emotional definition, okay? So for example, we'll do the first two together. Jamie acts immature. So you would check no, right? Not a behavioral definition. Sam bites his fingernails.
Yes.
Yes.
Yes. Fred displays threatening behavior.
No.
No. No, I don't know what threatening behavior is. What does that look like? Okay, go ahead and fill out the rest of those, either yes or no, and then we'll go through them.
What is threatening behavior as in like this?
Say that again.
Isn't this threatening behavior? If I do that,
I don't know. Is it?
the last time I checked, it's easy, not easy.
Okay, so what would you say instead of threatening behavior?
Aggressive behavior. Yes.
Joe held his hand in a position that looked like a gun. That's very specific. So,
That's by law, if I point my gun to her head and do this is considered threat.
maybe, depending on your definition of threatening.
That's a fact by law. this is considered
Okay.
threat.
Okay, but for the purposes of being measuring different types of threatening, different types of threats, what you would say instead is the person made a person made a gun out of their hand, or a person made a gun gesture out of their hand, or see what I'm saying?
Yeah.
That's very specific, because there's a huge range of different types of threats, right, for aggression. So we want to know specifically exactly what it was. Okay, let's go on to number 4. Sean snaps his fingers.
Yes.
Jerry wants his cards.
No.
Good job. Diane grunts.
Yes.
Jerry yells much louder than people talk.
Yes.
It's kind of a trick question. I
I
mean,
said yes.
I think two people could agree if someone's yelling louder than people talk, or, they have those sound meter things, that they bust people at parties, but not that I would know. If stuff's too loud. So that's kind of a trick question. It can be both. I'm gonna say yes. Because I think two people could agree that someone's yelling louder than most people talk. Diane, oh, wait, for a minute, wait. Lisa, thank you. Lisa listens carefully. No. You guys are rock stars. No. How do you know if she's actually listening? No, let's talk about it, because I'm sure somebody else just hasn't said that they thought the same thing.
So I was thinking about one of the members at the rec center. He's listening carefully because he will repeat everything that he heard that you didn't think he heard. Like, I know she's listening because she's repeating all that was discussed. So that's how I'm able to make the statement.
So then that's how, exactly, yep. Yep, Lisa repeated everything that Joe said. There you go.
I was just gonna say comprehension. So like, I say yes because you could say that they're listening because they didn't interrupt, but then say, can you repeat what I just said to you?
There you go.
And then you can, how many times were they able to actually regurgitate it?
Exactly, so you would say they were able to repeat what you said, yep. Jim does not like light.
No.
No, what could you say instead? Jim. Jim shuts light switches off. Good job, guys. Kate is disrespectful.
No.
Kate yells no and asks to check her schedule.
Yes.
All right. Jake loves attention.
No.
Jake says hello to everyone he sees.
Yes.
All right, so on lines, I can't see them. On lines 15 and 16, what I want you to do is think about a person that you work with. And I want you to write an emotional statement on line 15. So kind of like these last several did. Kate is disrespectful is an emotional statement. Kate yells no when asked to check her schedule is the behavioral definition of that emotional statement. Does that make sense? So I want you to use the person that you're working with and pick one of their behaviors, and first on line 15, put it in emotional description, and then on number 16, put it in the behavioral definition. All right, let's have a few examples. Who wants to share? Yes,
Are we sharing both or just?
both.
So the first one I said was Sue has tantrums.
Oh, tricky word for Stacy, I don't like tantrums either. Good one.
Sue throws items when she can't go to peers appointments.
Perfect. Okay, I would stop with that she throws items. We're just talking about the behavior. She throws items, right? We don't necessarily know it's because she can't go to an appointment. We're not there yet. Okay. There it is. We're not there yet. Okay, another example.
With, drinking doesn't like being in the house, they're tries to work every day, like nothing around.
Okay, good job. Be careful with that word elope too.
Is escape like worse?
He tries to leave every day by jumping out the window. Yeah. Here's my problem with elope is that we've sometimes tracked and defined the elopement behavior as someone just leaving their home or just leaving the property, when sometimes what that person's doing is using a coping skill to calm down so they don't punch you in the face. So is that really elopement? No, to me, they're doing a great job using a coping skill, right? How about a couple people online?
I just messaged them and asked if they'd like to share. If
Okay.
you'd like to share, you can take yourself off mute or type it in the chat.
Any others here? Oh, sure, yeah.
I used one that, full disclosure, I use this word right now in the behavior plan I have, and as we were talking, I was like, I should change that.
Great,
So
I love it.
I have Ben over shares, as the initial, and then I changed it to Ben shares personal and private information, including address and financial information with strangers.
Perfect, good job. Perfect. That's really scary, isn't it, these days? Anybody online got examples?
Pulling Jane Hordes,
Mhm.
pulling hair,
So Jane Hordes would be subjective, and pulling hair, that's very objective, yes, that hurts. Any others? Couple more from you guys, we'll give them a few more minutes, yeah.
I have Joe is having a bad day. Joe said today sucks.
There you go, you said it sucks. Perfect, all right, let's do one more.
oh, they clarified pulling your own hair when anxious.
Okay. Careful with anxious. How do we know someone's anxious? Unless they say they are, right?
Yeah.
All right, good job. Does that make sense? And that's strictly for the purposes of being able to measure the behavior, because if you can't measure it, you don't know if your plan is working, right? I worked with a guy who used to bang his head upwards of like 200 times a day, and he would hit his head on the wall so hard to the point he got the plastic end of the tack embedded in his skull. And so we put a behavior plan in place and staff were working with them, and you guys know staff turnover and how staff turnover happens. A month or so later, I went back and asked how he was doing, and they said, oh my God, it's terrible. He's banging his head all the time. I'm like, well, how many times a day is he doing it? I don't know, like 5 or 6. I'm like, yes, right? So you don't know unless you're actually measuring it and writing it down. Yeah.
So forgive me if this is jumping ahead, but that was gonna be my next question. If you need these clear, measurable things, and for me, I'm working with the staff, training them and then leaving them to implement the behavior plan, and then I come back weekly and say, okay, like, how are we doing?
Yep.
How are we able to see if our behavior plan is working if we do have that staff turnover, or sometimes people don't have time to count because, like you said, short staffed, and how many times a day they're going, like, how are we able to be successful if we don't have the resources to count things right now?
We will talk about that because you will have the resources because it's in your book
Okay,
and we're gonna get to it.
all right.
Good question. That's a
Thank you.
perfect question. Yep. All right. So once we know what the behavior is, right, and we can define it, all behaviors happen in settings. So we need to find out what is happening in that setting that is affecting that behavior so that we can change that setting, right? So what we're talking about are the ABCs of behavior. How many of you have heard of the ABCs of behavior? Some, no, good. Okay, so we're gonna talk about what those are. So the A, or the antecedent, is just what happens right before the behavior. Plain and simple. What did you see? What occurred right before the behavior happened? The B, we already talked about, because it is the actual behavior that you can define and you can measure, and it has an observer agreement. The C is what happens after the behavior occurs, right? Immediately after the behavior occurs, what happens? In our example here, what is the antecedent? What's happening right before? Well, first of all, what's the behavior?
Snorting.
Snorting. So what happens right before?
What happens before?
What happens? What is going on right before Toby snorts?
We can't see it on
Dad's just watching TV, right?
Right.
There's really nothing.
He's ignoring, he's ignoring Toby.
Exactly, right, yep. Okay, so then Toby snorts, that's the behavior. What's the consequence?
Dad talks to him.
Dad talks to him. Perfect. Okay. Go ahead. Alexa. Here's some other ones for you. So the antecedent is you're late for an important meeting at work. Here's where you gotta click that.
Oh, great.
You drive fast to get to work is the behavior. And the consequence is you get a speeding ticket, right?
Right.
Or, go ahead. Teacher gives math seat work is the antecedent. Sally draws pictures instead of completing math work is the behavior. And the consequence is Sally spends recess completing math work. I think there's one more. Dinner's announced by staff is the antecedent. Jeremy bangs his head on the armchair is the behavior. And the consequence is Jeremy's instructed that he has 5 minutes to get it together and get to the table. By the way, I hope that doesn't happen. That's gonna upset me. That is not, we don't talk to people like that. Okay, okay. Okay, what I want you to do, hold on. What I want you guys to do is decide as a group a scenario that you're going to use, okay? So someone share a scenario, decide as a group which scenario you're going to use. You're going to use the same scenario for a few more exercises down the road, okay? So pick a scenario, explain it to your group, kind of describe the situation and the individual, not using names, or, and then you're going to, within that scenario, talk about what the antecedent is to that behavior, talk about what that behavior is in behavioral terms, and then write down what you think the consequence is to that behavior. Okay. Now, like I said before, this is not how we would normally do this, because normally we would look at incident reports, we would pull data sheets, we would do all those things to look at that. For the purposes of this training, we can't do that clearly. So you're just going to be using, you're going to make some assumptions, okay, which we wouldn't do if we, but it's about going through the process. So have those conversations and come up with the antecedent, the behavior, and the consequence, and then we're going to share some examples. All right, so we're going to go ahead and share some examples. So who wants to share their scenario? Yeah.
So I had, her staff called in sick and,
She had a staff call in sick.
from her day service awareness.
Went to pick her up from her day
Okay.
service.
That was the antecedent. Right. Sorry, did I miss? I'm gonna move over here. 'Cause I need to be clear. Okay, go ahead.
You really is. The behavior was repeating, what she wanted, which was that staff to pick her up from day services, pacing, pulling out her hair, bending herself in half. The consequence, I mean,
She wanted staff to pick her up from day
She was
service.
able to de-escalate,
Was the-
providing information on what her day looked like, and giving her when the staff would get work again and who was picking her up that day.
I have no idea who you're talking about.
I can see that.
Okay, good, good. And I don't know if I mentioned this before, but I want to make sure that it's clear that the word consequence is not a negative thing.
Yeah.
Okay? It's just the outcome, it's just whatever happens afterwards. It doesn't mean it's a negative thing. It's not a punishment, consequence is just the outcome. Okay, who else? Go ahead.
Okay, so situation, we're supposed to do situation, right?
Mhm.
Okay, Jason and Kyle got an altercation. The A would be Kyle called Jason a bad name. The B would be Jason throws microwave at Kyle, Kyle throws microwave back at Jason. The C would be breaks microwave in oven.
All right, good job.
Individual receives weekly spending, chooses to spend the money on drugs and alcohol, and is constantly requesting more money. Runs out of money and needs aren't met.
And needs aren't met. Got it. Okay, good job. All right. Online, want to share some examples?
Anybody online want to share some examples?
I can share. My name's Lisa, I'm a case manager. I have a 20-some-year-old client that lives in a waiver home, and she is continuously trying to find ways to access the internet to get on chat rooms. And she's been giving out her phone number, her address, all this to strange men. And she has like sheets with like 10 pages of numbers. Staff have taken her to talk to the police department about the dangers involved with that, human trafficking, et cetera. She does not care. She wants to hook up with all these people for sexual purposes. Short of adding more rights restrictions, we're kind of at a loss of what to do for her.
So what's the antecedent in that scenario?
I don't know that I can identify one.
Okay. Can you think about maybe one time or one incident where maybe she did that anything was happening right before?
I mean, it's pretty much anytime she can get access to a phone. I mean, she'll even use her.
There you go. Yep. Yep, perfect. So antecedent is she has access to a phone, right? And what she does with that phone are things that are going to get her in trouble, kind of dangerous. She gives out personal information. And the consequence is what? Does she actually get a hold of these people?
Yes.
Okay, so that's the consequence.
Okay,
The consequence is she talks to these people. Okay?
correct.
Yep, okay, another example. Good job.
Thank you. There's somebody else.
Anybody else here want to share? Last chance. One more. Yeah, go ahead.
It is lunchtime.
I
and-
wish.
And the member takes other people's foods
Okay.
and shoves it in her mouth.
All right.
And the consequence is she sits in a separate, she then has to sit in a separate room until everyone's food is served.
Okay. Perfect segue into what we're going to talk about next.
Okay.
Oftentimes we get the consequence wrong. Okay? The consequence can be really tricky. Hold that thought because I forgot about this slide. So we're going to talk about this one. What you guys did was you just kind of guessed, right?
Yeah.
However, in reality, what we would be doing is taking data so we can actually show what are the facts and what is going on. So in your book, there's several different types of data collection sheets which you can use. It doesn't matter which one you use, just whichever one's gonna fit your needs and your purposes the best. But this is just one that is in section 5, page 7, which just tracks the time of day, tracks what was going on before. It's just the antecedent behavior consequence, right? To try to give us some more information about the settings and what's surrounding the behaviors that happen. Most incident reports are set up in this manner. Think about your incident reports. Most of them ask you what was going on or what happened before, what was the behavior, what happened, and what happened after, right? It's very important to pull this information out and look at it. Okay. My experience has been that doesn't happen a lot. And that once those incident reports are written and they get sent off to who they need to get sent off to, where do they go? Into a file. They ever pulled out again and looked at?
That's
Not
not
up to-
that.
I know, I know, I get it. There's not enough time in the day. I'm going to tell you though, if you make the time to pull those out and look at them, you're gonna see trends and you're gonna realize information that you missed. Because you have this staff who wrote this incident report, this staff who wrote this incident report, this staff, what you're looking for is trends, guys. It's not each individual incident. That's not gonna tell you anything, right? You gotta put them all together and find out what the trends are and what's really happening. If you can make the time to do that, and I know it's hard, if you can make the time to do that, it's gonna save you a lot of heartache down the road. If you can figure out what's going on there and try to put supports in place to change it. That makes sense? All right, so make sure these tracking sheets, unless it's a critical incident, which you have to write an incident report for. If it's not a critical incident as defined by DHS, you can use the behavior record tracking sheet instead, and it's gonna save you some time doing paperwork, right? Makes sense? But if it is a critical incident, do the incident report. See how I covered myself there?
Yeah, good job.
Woohoo!
I used to be an
Okay.
HCBS specialist, so she's covering her basis because
Yeah,
I know the
totally.
Iowa
Yeah, there
Administrative
you go.
Code.
Okay, go ahead to the next. Next slide. All right, so I jumped way ahead, didn't I? We are going to watch a video. And I have to do this one, right? In this video, I want you to think about.
We have a question online. Can I ask that right now?
Yes.
If you're only working with somebody a few hours a week and you're in their private home, so limited time and in their private home, how do you track that behavior and use those?
Yeah, it makes it much harder because you're gonna have much more limited data. But I would still, depending on the behavior, if it only happens when staff's there, if it happens in other situations or circumstances, just track it the best you can. And really, you're still looking for those trends.
Would you ask people what were you doing right before that happened and
Oh,
explore
yeah.
that with them to
Yeah.
try to come up with the antecedent?
Absolutely.
Okay.
Involve them in that process, because when we get to an intervention, we need their input. If they're able to give us their input, hey, what would have helped you? Next time, what can I do to help you so that this doesn't happen again? Absolutely involve them if possible. Any other questions? Okay, so we're gonna watch a video, and I want you to think about in this video, what is the antecedent, what is the behavior, and then what is the consequence? Okay, and then we're gonna talk about it. So in that scenario, it's pretty classic, isn't it? I think that's funny. I've watched this thing probably 1,000 times and I still laugh every time I watch it. Oh, what was the antecedent?
He's being ignored.
What does that mean?
Oh, he was not given any attention.
What does that mean?
The individual that apparently the child wants to notice is leaving the area, out of their sight.
Correct. The person walked out of the baby's sight, right? And what was the behavior?
Fall to the floor, right?
Falls to the floor and cries, right? Screaming, kicking. What was the consequence? Close. Walked up to him or walked away again?
Walked away.
Walked away again, right? Person walked away again. Okay, so are we back on the slide? No attention for crying during self-down. Yep, exactly. So here's where it gets tricky. Here's why this consequence is tricky. Because what you guys actually saw in the video, the consequence was mom or whoever was recording walking away again when the baby was crying, right? And the consequence of a behavior is what maintains that behavior. So the consequence of the behavior is what causes the behavior to happen over and over and over again, okay? Does it make sense that that's what happened previously in that video? What do you think has previously happened in that scenario with mom and the baby?
She's holding him or picking him up.
Exactly,
Lack of attention.
exactly. So most likely what has happened outside of this video was whenever the baby threw himself on the floor, mom went over and said, "Oh, honey, it's okay," and picked him up, right? That's probably what was maintaining that behavior. However, in that short period of time, we didn't see that. See why that consequence can be so hard? Also, the consequence doesn't have to happen every single time. And it could be something that happened years ago. So think of some examples. Gambling. How many of you like to gamble? You can be honest, it's all right.
I don't like losing money.
Well, I don't either. I know. Yeah, we're all human services. Heck, no worries. I'll make it all to my money. Sorry, we can edit that out right now. I'm keeping my money. Okay, so think about people who gamble. Do people who go gambling just to push the button?
No, it's the general.
The excitement of winning.
People go gambling because they might win, right? And for people who can become addicted to gambling, that possibility of winning is so strong and is so much of a consequence of winning that they continue to do it over and over and over. Even though, does it happen very often?
No.
No. However, the potential of it happening still maintains that gambling behavior. Now apply that to your situations. How many different staff you got working with people? One staff, once a week or a couple times a month, maybe providing a consequence to that behavior that is maintaining that behavior over and over and over and over again. And oftentimes we get the consequence wrong. And if we get the consequence wrong, we're going to get the function wrong, which is what we're going to talk about in a little bit, which means we're going to get whatever intervention we put in place wrong. Your example earlier where you said, shove the food in his mouth, right? That's the consequence. He got to eat the food, right?
But what if
The
you have
antecedent-
choke hazards as well?
Well, that's a whole nother, we're not there yet.
We're not there.
We're not
Okay.
there yet.
Okay.
So the antecedent is they're sitting at the table, the behavior is he steals food off of another person's plate. The consequence maintaining that behavior, just got a handful of food in his mouth, right? It's not oftentimes what we think the consequence is later, which is removing them and making them leave somewhere else, eat somewhere else. He doesn't care. He had his opportunity and took it.
It took it.
That's what maintained the behavior. That makes sense?
Yes.
So see how that can get really confusing and complicated, especially in this field? In the environments that you guys are in, with different staff, turnover, it can get really hard, really hard. So, the A is predictive. We didn't talk about the antecedent, but we did a little bit earlier. The A is predictive. So once you know what the antecedent is, you know that behavior is going to happen every time, right? And then the C is what is going to maintain that behavior. So we're going to be talking about several different things here. There are antecedent strategies that we can put in place, which basically means what are we going to do ahead of time? We know this behavior is going to occur, going to grab for that food. What are we going to do ahead of time to try to prevent it? Right? This is where we teach skills. This is where we modify the environment. This is where we do all of those things, okay? Then in a little bit, we'll talk about the consequence. What are we gonna do to change reactively once it happens? Okay, you with me? All right.
So
Go
I
ahead.
have a question.
Yes.
In that example that they're using, then that is a modification of the environment, right? By having that individual sit
Somewhere else?
somewhere else,
Yeah. Well, yes, that is a modification of the environment.
But then just teaching it a skill is missing, which is why.
What else could we, exactly, what else could we do instead of just
Can you-
modifying the environment?
Can you repeat that? Her statements.
Yeah, so moving that person to another place to eat is modifying the environment, so that behavior doesn't occur. However, what are we teaching? So what else could we do?
Thank you.
Put a staff between, okay? What else?
No, that's still a modification, right?
Yeah.
So you would have to, and I don't know the answer to this, but you'd have to have some training, for lack of a better word, on skill development with that individual about like, when food's in front of you, this is how, if it's not your food, this is how you have to.
Absolutely.
On your plate, maybe, I guess this is still be a modification if their name, they have like a nameplate on by their plate. but-
First of all, my question would be, why is he stealing somebody else's food? Okay, that's question number one. Is it because he has food restrictions for health reasons? Is it because he just never feels full and wouldn't eat till he's sick? Is it because we're not providing enough food? Is it because whatever it is, okay? So that's the first question you have to figure out. Once you figure that out, then you're gonna teach the skills surrounding that. Why is it a restriction if it has to be a restriction? What can we do instead so that it maybe, hopefully he can eat whatever he wants when he wants, but it's not gonna make him sick? Like free healthy food type things. All of those things would be questions that I would ask, but what we typically do, my experience has been what we typically do is we do something, and I'm not saying it's wrong because it works, right? Because we don't want this other individual to get ticked off and punch him in the face because they just stole his food. That creates a whole other chaotic situation. What we typically do is we move the individual somewhere else. You can eat over here. We stop the behavior and we're done. Okay, that's a Band-Aid. We didn't teach him anything, right? Very next opportunity he has to snag something, he's gonna snag it because we haven't really fixed the problem. We just put a Band-Aid on it. Make sense? Okay. Did you have questions?
So a little bit more on that, I guess it's a behavior, I'm not sure. But if there's a crumb on the floor or the table, this particular person will find it and.
Yeah.
And so.
Yes. So now you're talking more than just trying to get the food up somebody's plate,
Yeah.
right? And so there has to be more programming surrounding that because that's a whole other, yeah, whether it's FICA, whether it's, you know, whatever it is, that's a whole other, yeah. And there are sometimes, and you are absolutely correct, there are sometimes where you just have to prevent something from happening. Someone with FICA had an individual, a kiddo that would eat anything and everything. And I can't tell you how many times I had this kid in the emergency room. He ate a plastic lizard, for crying out loud. I don't know how people swallow these things. He ate a plastic lizard. I mean, so you have to prevent that. That is a serious health hazard, right? So that's an extra consideration you have to bring up. Okay, go ahead to the next. All right, so we're gonna start talking about the function of the behavior, okay? And the function of the behavior basically just means what is the person getting out of having this behavior, okay? Behaviors occur for one of two reasons, or for both at times. One is to gain something that the person wants, okay? So that's positive reinforcement. The other is to avoid something that is aversive. That's negative reinforcement. Negative reinforcement is not punishment. Negative reinforcement is one of the most misunderstood terms that are out there. Even in my master's class, my professor even got negative reinforcement wrong. I had to go ask like several other people, and this doesn't make sense. Negative reinforcement is not a bad thing. You can't think of the word negative as bad. Okay. You got to think of negative is you're removing something. Okay. So think about And positive is gaining something. So you're gaining something, you're removing something. For example, if well, we'll just talk about the food example. I grab a handful of food and I eat it. What is that? It's positive reinforcement, right? Negative reinforcement would be if you're asking me to go to work and do a job and I grab your hair and throw you to the ground so I don't have to do that job. What is that? Negative reinforcement. I got out of doing the work, right? Okay. You can't think of it as, it's kind of like, think about if I went to the doctor and I got a positive test for cancer, is that positive or negative? That's negative, that's bad, right? But it just means I have it. If I went to the doctor and I got a negative test for cancer, what would that mean?
Oh, that's positive.
That's good, that's positive, right?
Yes.
So you can't, it's about having or not having something. Does that make sense?
Yes.
Okay, you can go ahead to the next slide. Within those categories, there are reasons there within those categories, there are more categories. So for positive reinforcement, people do things to either gain attention. We do that all the time, right? People do things to get attention all the time. We do things to gain access to preferred items and activities. Or we do things to increase stimulation, right? You're drinking a jug of tea or coffee to, give yourself caffeine or whatever it might be, right? Go ahead and hit the next. So, such as making coffee in the morning. So you don't make coffee in the morning because you enjoy, hopefully, that's kind of weird. You enjoy the process of making coffee. Do you? Okay. Here.
The smell.
Sweet, okay. Okay, no, that's awesome. That is kind of cool. I don't even know what a French press is, but it sounds awesome. I don't drink coffee. But why really do you make the coffee? What are you getting out of it? What's the outcome?
Caffeine.
You get the coffee. Whether it is you like the taste of coffee, then you gain something that you wanted, right? Or whether it is the stimulation from the caffeine in the coffee, then you gain increased stimulation, right? Okay, go ahead with the next one. Negative reinforcement. So major avoidance categories, things that we do to avoid certain things, is we do things to avoid attention, right? It's my favorite. Julie Adams calls me. You guys are gonna know. And she knows this. She knows. I tell her. I do things to avoid attention. I don't like talking on the phone. And if my coworker calls me, because she talks and talks and talks. I love her to death. She's a great person. You guys know what I'm talking about.
Oh, yeah.
And she knows this. We've talked about it. She knows I use her as an example. So it's all good. Oh my gosh, no, not time for that because I know it's going to be a long conversation. I don't like to talk on the phone. Right? Or somebody, yeah, she just catches me in person. Yeah, exactly. Why do you think I went to part-time on this job? I'm kidding. Oh my God, edit that out. She's gonna hate me. I'm just kidding. Or don't tell me you guys ever have that salesperson comes knocking on the door and you run and hide, pretend you're not home. I do that too. So we do things to avoid attention, right? We also do things to avoid or escape aversive items and activities, such as work. None of you have ever done that, right?
No.
Liars, liars, liars. Yeah, liars. We all do things to avoid work sometimes. Or we do things to decrease stimulation, right? So you take an aspirin to get rid of a headache. You're removing something aversive by taking the aspirin, right? You have a headache, you want to get rid of it. That is negative reinforcement. Go ahead to that. Okay, I'll like. Anytime you're fine, you can read it. Okay. Anytime you're talking about reinforcement, you hear that word reinforcement, you're talking about gaining something. Okay, you're talking about increasing of it, not gaining something. I'm sorry, that probably just totally confused you. When you hear the word reinforcement, that means that we're looking at increasing the behavior. Increasing the behavior. All right. Reinforcement increases behavior, whether it's positive or negative. I do something and you let me out of work because of it, it's going to increase me doing that behavior to get out of work. Right? Does that make sense? Questions about that? Okay, so sensory integration. There's been a huge controversy over this, and it's all, to me, comes down to language, but about ABA and sensory integration. Is it real? Is it not real? What's increasing stimulation? But I am a firm believer in it. I have worked with people that this has been a huge concern for them. And once you put measures in place to help them kind of come back to baseline, can significantly help change behavior. So how many of you have heard of sensory integration or sensory processing disorders or concerns? Okay. All right, so basically it's the ability of the central nervous system to organize and process input from different sensory channels to make adaptive responses. So every day we are all bombarded with all kinds of sensory input, right? Even in this room, there's the temperature of the room, there's fluorescent lights that are flickering, whether you can see them or not. There is sound outside with cars driving by. There are people moving in their seats. There are people clicking pens. There is the sound of the projector. All of which you probably didn't think about until I just called attention to it, right? You are bombarded constantly by all of those things. When you have a problem with sensory integration, you're not able to block out those other things going on around you and to be able to sit here and focus on what we're talking about today. Okay. This is specifically prevalent in people with developmental disabilities, specifically people with on the autism spectrum, some people with some brain injuries. And if that is a problem and they can't block out some of that input coming in, they become what we call sensory defensive. Okay. Go ahead to the next. So some behaviors that you might see in somebody who may have some types of sensory processing problems is maybe people who layer clothing. People who resist grooming. How many of you work with someone who resists grooming? That one's huge. Brushing teeth, hygiene, brushing teeth, taking a shower. Yeah. Self-injurious behavior. We work with somebody with SIB. Could very much be some type of sensory issue. Self-stim type behaviors. People who hit, bite, kick. Any of the behaviors that you see could be a result of some type of sensory processing concern. Okay. Now, I'm not saying just because somebody does hit, kick, bite, any of these things that guarantees, oh my gosh, they have a sensory. No, it doesn't mean that. It means it's something you need to think about. It's something you need to consider. Okay. If you don't, you can come up with the most extravagant behavior support plan in the world that you want to try to teach new skills. But if you're not helping this person to manage that sensory defensiveness, you're not going to get anywhere. It's just not going to work. I have seen this happen over and over and over again. I worked with a guy who transitioned out of an institution. And when he moved, I told the agency, absolutely do not ever restrain this guy. Never put him in restraints. He has huge sensory processing issues. You put him in a restraint, he is going to become restraint dependent because look how much sensory input you're giving somebody when you put them in a restraint, right? We made a very specific schedule to do sensory different activities all throughout his day so that that need was getting met so that he didn't get to the point where he had behaviors that we had to restrain him. Well, what do you think happened? The schedule wasn't followed. This guy started having behaviors and they put him in restraint. What do you think happened to his behaviors? Through the roof, went through the roof. To the point that they were going to discharge him. So I went back again several times. I know I get kind of angry, you know, when people do things not in the best interest of people I care about. Sorry. And we finally got them to start putting these things in place. Okay. So finally started instituting, I mean, we had to up the schedule really thick. So he was getting like sensory input every hour. There was something we were doing every hour to try to prevent putting him in some type of restraint. So over time, it got to a point where if he started to get upset, all the staff had to do was go put pressure on his head, give him massages, pressure on his head for a few minutes, 5 minutes, whatever. And then he was fine. No more restraints, behaviors went straight down. So my opinion, from my experience, for some people, this is very, very real. And for some people, if we don't have that handled and we don't have processes in place to help them stay regulated, we're going to see issues. wouldn't have problems. I think all of us to some extent have different sensory processing things like tags and shirts. Get out of there, handle it.
I was just curious, how did they come to that realization? Was that like the trial and error, like every hour they were doing something different and oh, that one stuck because it seemed to show the most?
Yeah, pretty much. However, not without some guidance. So that's the next, if you want to go on to the next slide. We do have, oops, I lied. You're fine right there, though. You can leave it there. Okay. In your workbooks, section 4, page 1. Yes.
So with this, is it that so they can't zone out some of the stimuli, but so increasing the stimuli makes just like one more prevalent, or would it be sometimes like taking the stimuli away?
Sometimes it's taking it away. Sometimes it's taking it away. Yep, it would depend. So there's different types of sensory defensiveness. And if you look in your binders, section 4, page 1, in here, there's a sensory inventory. Basically, what this is an assessment. You just go through it, have as many people fill it out as possible that knows the individual. And they're just different behaviors that you can mark if you see the person doing some of these behaviors. Okay, so you go through and fill this out, and each page is a different sensory system. So the first page is tactile, the second page is proprioception, and the third page is vestibular. So what you can do is just go through and mark the behaviors. And if someone has a lot of things checked in one of those pages or one of those areas, it means they might be sensory defensive in that area. Okay. So then you can use that to help guide yourself into what activities maybe you put into place that would help meet that need. That make sense?
Should this be an automatic assessment that we're looking at for all people we work with, or should we start paying attention to like, okay, I see a few of these things, maybe I should do a little assessment?
That's really up to you. I mean, it's up to you and the people that you work with. It's never going to hurt, that's for sure.
Yeah, I'm just wondering if something would be missed if we didn't.
It might.
Because I wouldn't know all these off the top of my
Yeah,
head. Like,
it might.
oh, Sally, yeah.
Yeah. And I mean, that's the other thing is you have to be careful. Just because somebody has one or two behaviors in that section does not mean they're sensory defensive in that section. Okay. So it's, yeah.
So I know with, like, working with parents, a lot of this stuff can be discovered by occupational therapy.
Exactly. Yep.
For adults though, I know it's not as predominant as it is with children. So is there just not occupational therapists that work with adults in this way?
Right. Not to my knowledge. I'm not really sure. What I do know for sure is there are a lot more of these types of services for children than what there are for adults. So that would not surprise me. Same with behavioral intervention stuff for applied behavior analysis, funding, insurances, other funding. It pays for children, but not adults. Because there's some question, does it work for adults? Well, I've worked with adults my whole life. I believe, yes, it does.
I think that we would be a lot more successful in our position if we did have that as an outlet, because it wouldn't be so much trial and error for us.
Yep.
It would be.
I 100% agree. I more than 100% agree. But I've worked up that tree for a long time. But
I'm
yeah.
asking my son, he is autistic, and it made a little bit.
Absolutely. Yep, absolutely. Yep. Okay. Do you want to go back to the, I'm sorry. Yeah. I don't know how you're doing all this. I would be like, oh.
Right?
She's answering questions and she's going between screens and. Okay, so some of the activities, and this is just an example, some of the activities that sometimes we can put in place to help regulate people are things like different lotions and rubs, massages, ball pits, swinging, therapy balls, weighted vests, weighted blankets, all of those things I'm sure you guys have heard of can sometimes really help people who are sensory defensive. So it's finding what's going to work for that person and putting that in throughout their day so that they can stay regulated. Okay. Questions?
What is the number one?
Wheelbarrow protocol is really kind of outdated, I think. I don't know, because I'm old, I think it's called something else now. But hey, you guys have seen those little brushes with therapy brushes? Yeah, so it used to be a very specific protocol where you went through a brushing technique and joint compressions with somebody that gives you just a burst of like sensory input that we used to have to practice on each other and do this. And it's like afterwards, it was just like, you had the most amazing massage ever. And you're just like, oh, it's just relaxed. So that's what that is. Okay, so I like cartoons. So here's another example of consequence behavior, antecedent consequence behavior, and then what the function of the behavior is. So we have Calvin and Hobbes, right? So Calvin's the cat, right? I always get screwed up. Calvin's the cat, right? Hobbes is the cat? Oh my gosh. Okay, so Hobbes is getting a belly rub from Calvin, right? Okay, so the antecedent is Hobbes is getting a belly rub. Nope. The antecedent is Calvin walks away. Hobbes was getting a belly rub. Calvin walks away. The behavior, Hobbes growls and is like gonna bite Calvin's face out, right? So consequence was Calvin came back and rubbed Hobbes' belly again. What do you think the function of that behavior is? Positive or negative? Positive reinforcement in the form of what? Belly rub. He gets his belly rubbed, right? Now, what gets really interesting about this is this all works is like a never-ending cycle, okay? Because it also works the other way. For Calvin, okay, the antecedent for Calvin is that the cat screamed at him, is about ready to eat his face off, right? So the behavior was Calvin came back and rubbed Hobbes' belly. The consequence is Hobbes stopped growling at him. Positive or negative reinforcement?
Negative.
Negative reinforcement in the form of what?
No more growling.
No more growling. It's a vicious cycle. You see that? So the people we work with have behaviors. And we as staff do things to try to stop that behavior. And we find something that works and the behavior stops. And what we're actually doing is reinforcing that behavior. So it happens over and over and over again. So we have to keep doing the same thing over and over and over again, which is just reinforcing the behavior. We get an outcome from stopping that behavior, right? If we give in and just give Joe the cookie, it's going to stop screaming at me, right? You are negatively reinforced because you don't have to deal with that behavior anymore. But you just positively reinforce Joe by giving him a cookie for screaming at you. That makes sense? See how that happens, how that works? And it all only takes one staff, one time. And here we go. Okay, go ahead. So when you're talking about reinforcement, if you guys remember, we talk about reinforcement, it means we're increasing a behavior. So let's say that I take out the garbage because when I do take out the garbage, my significant other stops screaming at me to take out the garbage. Right? Would that be negative or positive or negative? Sorry, I jumped ahead again. Negative, the yelling stops, right? Or I might know that if I take out the garbage, maybe somebody would come and say, hey, you did a really great job. Thank you so much for taking out the garbage. Increase my garbage taken out behavior. Right? Or, go ahead. Maybe I do something nice for somebody so they give me this gas gift card. Who wants a gas gift card right now? How many of you would do quite a bit of anything for a gas card right now? Right? If I do something nice and somebody gives me a gas card. Or typically a noise starts going off of that. You know that seatbelt noise when you don't put your seatbelt on? That okay, so we buckle our seatbelt to get rid of that noise, right? Or we buckle our seatbelt so that our head doesn't go through the windshield. Or we buckle our seatbelt so we don't get a ticket, right? All of those things increase our seatbelt usage. Okay. That's all reinforcement. That is all increasing a behavior, right? When you get down here and you start looking at punishment, anytime you start talking about decreasing a behavior, you're talking about punishment. punishment decreases behavior. Okay? So positive punishment is this. I hope none of us are doing anything like that. DHS certainly frowns upon that. It's not okay. We can't do those things, right? We don't do positive punishment. It used to be a thing. I mean, we used to have lemon juice squirted in people's mouths. We used to have water sprayed in people's faces. We used to have, I mean, we used to do horrible things to people. Positive punishment was used a lot. Hopefully, it's not anymore. However, just not that long ago, I saw a video clip on a news episode where a school district was tasing a kid who was having a behavior. You see that? That's positive punishment. And from the video, I didn't see this kid doing a whole heck of a lot except not working. And they tased him, which ended up really, really bad. Anyway, don't do that stuff. Come on. I'm not gonna do those things. That's not a very humane way to treat people. However, we do this all the time, take things away, right? Just, I don't know, the example that always comes to my head is you had a behavior today, so we're not going out to eat tonight. Right? When you guys have a bad day at work, and maybe you got in trouble at work, or maybe you did something you shouldn't have done, do you tell yourself you can't go out to eat tonight because I did bad at work today?
No, keep your wine.
Exactly. I mean, come on, guys. You don't say, oh, bad me, I'm not gonna go out to eat tonight. You go out to eat and you have wine because you had a bad day. How does that make any sense? How does that make any sense? For the adults you're working with, how does that make any sense whatsoever? When we start thinking about it in terms of ourselves, it doesn't make any sense, does it? No. So we can easily take this and put it up here by doing things such as just motivating people to do things that they need to do, right? We do that all the time. When you have something that you really don't want to do, but you know you have to do it, do you ever say, all right, I'm just going to push through this, I'm going to get this done, and then I'm going to, whatever it might be? That's all we're talking about, guys. That's all we're talking about. It's not rocket science. By the way, that's very funny, because I must say that a lot, but it's not rocket science, because the other day, my son, oh my God, it was so funny. I said I moved recently, right? And so I had this ratchet strap holding in our bed in the back of the truck, and I asked my son to undo it, and he's over there messing with it, and he's like, Mom, this is rocket science. I must say that way too much. Anyway, so we can easily motivate people to do things that we need them to do, right? We're not taking anything away. We're not saying you can't go out to eat if you don't take a shower. Hey, buddy, why don't we hurry up and go take a shower so then we can go out to eat? You know, let's go get something to eat. Let's take a shower. Let's go out to eat. Not if you don't take a shower, you don't get to go out to eat. Does that make sense? Yeah. Now, a couple things about this is when we're having this conversation about motivating people and about punishment and about all those things, if you are an HCBS waiver provider, you cannot arbitrarily tell someone that they can't do something. Okay. For example, if you say to somebody, hey buddy, let's take a shower and then we'll go out to eat. If they don't take a shower and they still want to go out to eat, you're going out to eat. Okay, you with me? The only time that you can modify that is if it is specifically written into that person's plan, that is a plan you're working on and a goal you're working on. Okay. For example, I use schedules a lot with people that I work with, specifically people who we can't get to do the things that they have to do. You know, there are some things we have to do to stay healthy, right? We have to take a shower at least once, a couple times a week, right? Or it's not healthy for us. We have to eat. Some people have medical issues where there's certain things they can't eat or have to eat. We have to take, some people have to take their meds, right? Sometimes I will put plans in place that sandwiches things that people don't want to do in between two things that people really love to do. So for example, we're gonna have a snack. No, we're gonna, maybe we went and did something outside. We're gonna come in and have a snack, or we're gonna get I don't know, go get ice cream, or we're gonna whatever, and then we're gonna take our meds, and then we're gonna have dinner, and then do you get what I'm saying? And you don't move on in that schedule until that non-preferred thing is done. So often, and those are only things that are written into a plan that are rights restrictions for a person. You with me? Makes sense. Right? You cannot arbitrarily restrict people's rights. It's not what we do. It is their right to do the things we want them to do. However, in a speaking behaviorally, if there are things that we need to change, behaviors we need to change for a health or safety reason, this is sometimes a plan that you can put into place. Okay? Something highly preferred, something not so preferred, something highly preferred, something not so preferred. So you're never taking anything away, right? You're always adding to that person's quality of life. It just may take longer than usual if we have to wait them out. Does that make sense? I'm never going to take going out to eat away. It just means we might go out to eat at 8 o'clock or tomorrow or whenever, after that certain whatever non-negotiable is done. Does that make sense? Over time, what you will find is that period of time between not wanting to do it gets shorter and shorter and shorter and shorter and shorter. Because they know, oh my gosh, all I got to do is swallow this pill and we get to go out to eat. No, it's not that hard. But instead, what do? What do we do when someone doesn't want to do the things we ask them to do? We take things away. What else do we do? Which just immediately is gonna make you mad, right? See, I about swore I caught myself. Even though it can be modified, whatever. It can automatically make you mad, right? But what else do we do besides take things away? Threaten. Ultimatums, try to coax and convince. Dude, come on, all you gotta do is just take this, 'cause it's not that hard. Come on, just take this and we'll go. What are you doing when you do that? Yeah, poking the bear. You're adding all kinds of reinforcement to that whole scenario, aren't you? Come on, dude, all you have to do is just take this and let's go. And we put all this attention surrounding it. What did we talk about earlier? Not, right? Not doing that. Okay, so like I said earlier, I'm not going to tell you that punishment doesn't work, because it does. It works quickly. The problem with punishment is it doesn't last long term. It very much can damage the relationship that you have with that person. And what happens when the punisher isn't there?
The behavior continues.
Exactly, the behavior continues. So let's not live in this world down here. Let's go up here and we're actually adding value to a person's life, okay? Not controlling and taking things away from people. That makes sense? Okay, go ahead next. I think, I know you're like, wait, is it lunch? Is it lunch? Is it lunch? Oh, almost, okay. So go ahead to the next slide. Sorry, we were talking about all that. So let's go back to our examples here, and this one goes fast again. Let's go back to our examples here. Don't click it. No, okay, sorry. So math seat work is given by the teacher. Sally draws pictures instead of completing math work. Sally spends recess completing math work. Do you guys think that consequence is accurate? This is not in your packet, I don't believe. Is that consequence, does that make sense that that consequence is maintaining that behavior? And that makes sense to me. But what if we added in chatting with the teacher? Now, what is the function of that behavior? One-on-one conversation. One-on-one conversation with the teacher, positive reinforcement, right? So you're going to handle that scenario in a certain way, maybe try to give some one-on-one attention at other times or whatever it may be. However, what if it was, and does not have to go to the playground where Jimmy the bully often targets her? It's negative reinforcement, right? Would you handle those two situations the same way? No. See why that function is so important. Because whatever you do is going to determine, are you increasing that behavior or not? Right? You can sit and have a one-on-one conversation with her all day for not completing your math work, but if you don't fix the bully problem, right? It's gonna continue to happen. Okay, go ahead to the next one. When dinner's announced by staff, Jeremy bangs his head on the armchair. Jeremy's instructed that he has 5 minutes to get it together and get to the table. Does that make any sense?
No.
No, but what if we added and gets to finish the level on his video game? Positive or negative reinforcement? Positive in the form of what?
He gets to finish his video.
Yeah, it's an activity, complete an activity he likes. Or what if Susan, the staff member that he really likes, persuades him to come out and sit by her? What's that? Mhm. That's positive reinforcement, right? He's gonna get attention from the staff member. Or, yep, go ahead. He's assured he doesn't have to try any veggies. Negative reinforcement. He's getting out of eating his veggies, right? All three of those scenarios we would handle in a different manner. So if we stop at get it together, dude, and come to the table, we're not gonna get it right. We're not gonna have the right intervention because we don't have all the information, we don't have the right consequence. Make sense? Okay, go ahead and next. We're almost there, guys, I promise you. Okay, so this is really how dog training works. This is so funny, I think. Go drop a load in the living room. How do you have dogs, by the way? Pets, whatever. This is so true. Go drop a load in the living room. After 4 or 5 times, just stand by the door and they'll let you out anytime you want. When they call you back in, just ignore it. Eventually they'll stop screaming and offer you a cookie. So I am fully convinced that our pets train us and our children train us, that we are so just, we don't do it. Anyway, okay, go ahead. So one more couple more examples of why the function is so important. Timeout, well, there's sometimes a common consequence. Not anymore, we don't call it timeout, right? What do we call it now? Break. Go take a break. Go take a break in your room. It's the same thing, people. Timeout, break, it's the same thing. The difference is, are you trying to help this person calm down and suggesting something that might help them calm down and work for them? Or are you demanding and saying you need to go to your room? Big difference, right? Traditionally, this has been, I can think of classrooms, you're done, you're out, go sit in the hallway, go see the principal, go whatever. What if positive reinforcement, what if negative reinforcement was desired? What if I wanted negative reinforcement and you just sent me out to the hallway? What'd you just do? You let me get out of class, right? Just did exactly what I wanted. So guess what? Bet you next time I'm going to do that same behavior because you're going to tell me to go out in the hallway and I don't have to sit in that classroom anymore. However, this one is even more prevalent is when somebody does something wrong, we talk and 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 we talk. We talk so much and try to coax and convince and lecture and tell people why something they did was wrong, tell them what they should do next time. You have to go apologize, blah, 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 blah. Sound familiar? If positive reinforcement was wanted and you did that, what did you just do? You just reinforce that behavior. That one's hard. We do it all the time, all the time. I can be sitting right beside somebody and saying, don't give him any attention for doing that. He doesn't. Stop. You just gave him attention. No, I didn't. I just told him to stop. That's attention. It doesn't have to be good attention. For some people, even negative attention is attention, right? Think about people's history. For some people, any type of attention is better than nothing. All right. Go ahead. So traditionally with behavior modification, another concern with behavior modification is when we take things away from people and we use that punishment, what happens when you have nothing left to lose? Game on, baby. Right. I worked with a kid who was living in the community, and I mean, I was asked to come in and consult with them, and so I did. Sometimes people don't like me much. So I did, and I walked into this kid's room and there was nothing in there. I mean, literally nothing in this 9-year-old kid's room. There was a mattress on the floor, no toys, no clothes, no bedding, no nothing. I said to the staff, I'm like, what's going on here? Where's the stuff? Well, he's lost it all. What do you mean he's lost it all? Well, he has to earn it back. What does he have to earn back? Well, his bedding, no. If you guys want me to help you and you want me to work with you, you need to give him all of his stuff back and we will go from there. Do you think they call me back? Nope. When there is nothing left to lose, what are you gonna do? Put yourself in that position. Screw you guys, let's go, right? Nothing left to lose. All right. So earlier on slide 29, you used an example, your own example, and completed the antecedent behavior and consequence sheet for your specific scenario. This version of the worksheet now adds the function of that behavior. So this time I want you to use either the same scenario or a different one, and think about what the function of that behavior might be based on what you wrote down for the antecedent, the behavior, and the consequence for that behavior. So if you can, just pause the recording to give yourself a little more time to work on this worksheet. And you can find this worksheet on page 34 of 52 in your workbook. Anyway, all right. Let's share a few examples. Hopefully you all were able to come up with the function of the behavior from your scenario. So let's just go over a couple examples to make sure we're all on the same page, and then we'll move on. So who wants to share theirs? They're not very nice, are they?
Okay, so we had a scenario of an individual who was slamming their fist wherever they're positioned. So moving back to the last time we did the exercise, we said the antecedent was the change in an ability or the baseline capabilities to express emotions. That's what happens, that they notice happens right before the behavior. And then the behavior is slamming fists wherever she's currently positioned, whether it be on the shower wall, table, chair. Then the consequence is I feel like I'm not saying this right now, but she's saying things like, I was naughty, I need to go apologize. And
I need to put myself in a timeout.
No.
Yes. Which then, I guess that's kind of part of the behavior too, because then the staff would remind her to verbalize her feelings, give her some sort of like reassurance of what to do. So the function was getting this attention and a positive reinforcement to the behavior.
Okay, good. Yeah, very well could be. So just, I mean, there's no right or wrong answers with these. I mean, just so you know, I mean, we don't have the data, we don't have, and oftentimes there's more than one function to the behavior. I mean, you can have a behavior, it's complicated. So that sounds completely reasonable to me. All right. Okay, who else wants to share? What, y'all become shy after lunchtime or what?
We did,
Yeah, start with the antecedent.
yeah, so
Yeah,
the
the whole.
antecedent would be staff asked the member to brush their teeth. The behavior was that he slapped his leg and shouted no. The consequence was he did not brush his teeth. So the function was negative reinforcement.
Yep, absolutely. Escaping brushing your teeth, right? Yep, that's a good one. Perfect. All right. Anybody, let me know if somebody online wants to share. Yeah. anybody online?
Hopefully we're not wrong.
Nobody's wrong.
So the peer said, the antecedent was the peer says to the member, don't call me that, it makes me mad. The member then immediately starts yelling, what are you gonna do about it? Shut up or I'll shut you up.
Well.
So the consequence is removed from the activity or the area. The function would be the feeling of safety no longer threatened. Positive?
Okay. Well, if you think the function is removal of the situation and not being threatened anymore, that would be negative because you removed that threat.
Okay, so we're not adding a feeling of safety. That's where we were.
Maybe here's where it gets tricky. It is in a community setting, this makes life even more complicated.
in clinic type settings, you can test some of those things and add variables and take away variables to see, is it really, I feel more confident and comfortable now because that was removed, or is it because that was removed? I don't have to see that person anymore. You know what I'm saying? That's why you have the two scenarios on there, is because it's not always just cut and dried. Sometimes you have to test your theory, test your hypothesis of what you think it is. Now, like I said, in clinic type settings, that's a lot easier. In the community type settings, that's a lot harder. Sometimes we think people are doing things for attention when actually people may be doing things to get items or things that they want, right? So in theory, you could test that and set up a condition where every single time the person has a behavior, you give them what you think it is, that whether that's attention or the item. You with me? Probably going down a rabbit hole here. And if the behavior continues, then you know that's the function. If it doesn't, under that condition, then you know it's not. You know what I'm saying? So sometimes, and sometimes it can be either or, and that's where it gets really hard. So that comes down to, let's try this hypothesis out and see what happens. If it doesn't work, then we know we're going to switch and we're going to go in this direction. Either way, though, for that one, you're probably going to handle the situation the same way, right?
Well, when it wasn't removed before he attacked.
Yeah.
And this is a real life scenario.
Yeah.
Well, I didn't think you'd be making stuff up. I'd hope.
So, yeah.
Okay, good. All right, let's do another example. Anybody online? Anybody else out here? They go to lunch and they say, I'm done for the day. Thank you. Come on, guys, just one more.
So our entity was, our individual receives a regular weekly spending check. The behavior is this individual spends that money on street drugs, alcohol. The consequence is that they don't have money available to them to fulfill basic needs.
You really think that's the consequence?
Well, the other discussion, I mean, the initial consequence is that they get what they need.
Which is what?
The drugs, the alcohol, the whatever they're getting from.
That's the consequence. That's the consequence right there.
Yeah.
They're using, that's what's maintaining the behavior, not that they don't have money for their needs.
Right.
You get what I'm saying?
Right.
So gets money, goes out and gets the drugs. The consequence is I'm getting high, or I'm getting drunk, or I'm getting whatever, right? That's what's maintaining me going out and getting that. Not the not having food or whatever else.
Wouldn't that be a positive reinforcement?
Positive reinforcement. Yep.
I'm learning.
There you go. Good job. Good job. Okay. Things are about to get complicated, more complicated than they already are. No, I'll try to make it simple. Does that make sense so far? This whole concept of if you don't have the consequence right and you don't get the function right, you're going to get the wrong intervention. Right? That make sense? Okay. If you take nothing else away from the training today, I want you to ingrain that in your brain. That you have to take the time to figure out what the function of the behavior is. Once you have the function of the behavior, then and only then can you start putting in place strategies or behavior programs or whatever else to try to change that behavior. Okay. Prior to that, it's basically like a shot in the dark. You're not going to know. Okay. So once you know what the function of that behavior is, then you can start talking about what are we going to do about it. Okay. And remember how we talked before, we talked about antecedent strategies, right? So things we can do proactively, whether that's changing the environment, whether that's whatever it is. Well, now we're going to look more on the consequence side and how are we going to stop that behavior from occurring, right? So if you know why the person's having the behavior they're having, what are you going to put into place to match that same outcome?
This is why it gets complicated. It's really challenging to explain in like half an hour's time. Because really, we're talking about functional communication training, which is something that we could talk about for a week. So we're just going to talk in general terms. There's information in your binders, but we're just going to kind of talk in general terms related to some of your guys' scenarios. Okay. So this is where we're just going to go over these slides kind of quickly.
Okay.
Actually, just go ahead and skip the 49. We'll be good. Once you figure out the function of the behavior, do you remember before where we said we're going to minimize our attention to the behavior we don't want to see, right? Remember that? We're going to put that on what we call extinction. Then we're going to give all of our attention to new skills and new behaviors that we want to see that we're going to teach this person to do. Okay. Now, the key here is it has to match the function. So if somebody is doing something to get your attention, if I come up and punch you, because I know if I punch you, you're going to jump in and say, whoa, 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 stop, time out, and that's what I want, to give me attention. You're going to teach me another way to get your attention without punching her, right? If I'm doing something to get out of doing work, because I don't like work, and so I don't know what, I take off and I elope or I run or whatever, to get out of work, what are we going to teach the person? Instead of taking off and eloping.
How to ask for a break.
How to ask for a break, or how to say, this job sucks, I don't want to do this. Or how to say, I want to go find a different job, right? You don't have to run away, dude. You don't like it, let's find you a different job. Get where I'm going? So some of the things that you need to think about when you're deciding to teach someone the skill to replace that behavior is you have to make sure that whatever you're going to teach them is going to be efficient. Okay. So do they know how to do whatever you're trying to teach them? Can they easily do it? Or is it easier for me just to come up and punch her in the face? I really don't want it. I'm sorry. It's probably a bad example.
That's
all right. To get his attention, right? Is it dependable? Every single time I say, hey, I want your attention, is he going to be right here as quickly as he would be here if I hit her in the face, right? Is it dependable? Is it understandable? So whatever am I communicating, is it understandable to the general public, whoever, that I'm saying I want his attention, okay? This one, sometimes, you know, we get to know people that we work with really well, right? Mm-hmm. And sometimes we know what people want because we know them, we work with them, we know their mannerisms, we know how they communicate, and we know whatever. However, if somebody else off the street walks into work with that person, because it'll happen, as a staff turnover, are they going to understand? So it has to be understandable to other people besides just that person that has a really close relationship with that individual. Because when that person leaves, what did you just do to that individual? Right now, nobody understands them again. Or is it easier just to come up and punch her in the face? Less time, quicker, more efficient, because you're going to come running right now if that's what I do. Does that make sense? Yeah, you go ahead. Whatever you're going to teach must be effective, meaning it's going to result in the desired reinforcement. So if I hit her, you're going to give me the same attention, the same quality attention, the same amount of attention. If I were to ask you, hey, can you talk to me for a little bit? So when I hit her, if he comes up,
I'm not offended. Trust me.
If I hit her and he comes running, he's, oh, stop, you can't do that, you can't, whatever. When I say, hey, can you talk to me for a little bit, it better be with that same enthusiasm, right? Yes, oh my gosh, thank you for asking me to talk to you. Let's go hang out for a while. You want to go get ice cream or something? Well, actually, I really do kind of want ice cream. I love ice cream. Okay, all right. That makes sense. It's got to be the same. Has to provide an immediate result right now. You better come running just as fast if I say I want to talk to you than what you would if I hit her. During teaching, many opportunities may be needing, and then you go to shaping. So granted, I'll give you another example or another scenario to kind of explain the shaping and the trial needed. So Do you guys work with a lot of people? I heard some day program conversations earlier, people not wanting to go to day programs and or, work. We've put some people in some really ridiculous work situations before, in my opinion. I mean, I wouldn't want to do some of those jobs. So let's say that somebody has a job and every 5 minutes they start hitting their head because they really don't want to work. Okay, so hitting their head is getting them out of doing work, right? So you're not doing anything. And we don't want that to happen. So we're going to teach Jim how to ask for a break to get out of work. All right. So we're going to start with the same person working with this individual over a period of time and try to separate I hit my head and I get a break, and make the connection of if I sign for break, I get a break. Okay. So we're going to set up a structured teaching program to be able to teach that individual how to sign for break. Okay. So depending on the individual, you might start from, the least prompting, wherever that person's at. You may have to start hand over hand. You may have to start just verbally. You might, whatever that individual skills are. And every time this person starts hit their head, you're going to say, hey buddy, do you need a break? You want to take a break? Just sign break. You do hand over hands. Oh, great for letting me know. Go take a break. Okay. As you teach that skill, and you're going to completely ignore the head banging. Okay. Not paying attention to head banging. You say break. You're going to go take a break. Once that person learns to sign break, or they have the actual physical capabilities of signing break, you're going to do the same thing. You're just going to continue to prompt. If they hit their head, you're not going to do anything about it. If they sign break, you're going to say, great, that's perfect. Let's go take a break. Problem with that is once you get to that point, and let's say this person's signing for break every 3 minutes, right? I mean, that's what I would do. You break every 3 minutes if you're going to let me. That's where you do the shaping, where the person asks for a break. You say, okay, that's great. Let's do 30 more seconds of this and we'll go take a break. And you start spreading out that time frame. Or that's great. Thanks for letting me know. Let's do one more piece of paper and then you can go take a break. And you start spreading out that amount of time that the person can tolerate working before they have to take a break. Okay. But the key is that person knows they can ask for a break at any time and they don't have to hurt themselves to get it. Right? Making sense?
Yes.
With me so far?
Yes.
Okay. You go ahead and go to the next slide. So as you start to see that alternative behavior, that taking the break starting to increase, you're going to see the head banging decrease because it doesn't serve a function anymore, right? You're asking for a break is serving the same function, so we don't need the head banging. Okay, go ahead, Alex. All right, maybe not. Okay, does that make sense? Typically, well, I shouldn't say typically, especially in the community type settings that you guys are working in, you're going to have somebody who's going to be writing a structured teaching program for you if you're trying to teach a skill like that for somebody. In the community, it's much more challenging. What are some of the other skills besides communication? Because when we talked about if we see behaviors as a lack of communication or skills, our job becomes to teach communication and skills, right? Besides communication, what other skills do we often find ourselves needing to teach people in the community?
Can you repeat that question? Oh.
Yeah, besides communication, what other skills, thinking about in the terms of behaviors and challenging behaviors and how do we help people, what are some of the skills that we have to teach in the community? Well, for anybody really, but,
Self-control.
Self-control,
Coping skills.
coping skills. Let's talk about that a minute. Coping skills. Yes, we need to teach people coping skills. Yes, it needs to be skills that actually works for that person. How do we do that? How do we teach coping skills to people? Maybe.
You, I guess, first acknowledge whatever the antecedent is that's causing the
Yeah.
behavior thing, and then from there you get the fidget or
Yeah, perfect. Good. You're actually starting with listening. That's great concept. It's actually listen to people. Yeah. Yeah.
I was gonna say it has to derive from that. So
Mhm.
what will help you?
Exactly.
Um,
You know, we have the classic structured coping skills that are out there. You can look up, you know, that Google thing that tells you anything and everything you want to know. But it needs to come from that person. What's going to help that person, right? You guys know what would help you calm down. We need to find out from them what would help them calm down.
Online here, we have coping with stressors, decision-making, and then they touched on what you were taught, problem solving, and they touched on what you were just talking about, asking them what truly makes them happy and using that. So it's individualized, and then observing things that de-escalate them in real time.
Yep, absolutely. Good. So coping skills, along with problem solving, along with delayed gratification, along with all of those are not those concrete skills that we are used to teaching people, right? I'll bet anybody in this room and all of your staff could teach someone to use the microwave, teach someone to load the dishwasher, teach someone to make their bed, teach someone to brush their teeth all day long, right? Very concrete. We know what we're doing. But when it comes to some of those softer skills, like problem solving, coping skills, that gets a lot harder for us to try to teach people. They're much more complicated skills. So coping skills, definitely a huge one, that helping people learn to just cope with all of those triggers that they're going to run into every single day, right? One problem I have with coping skills is when, I don't know how many times I've heard somebody who's been having concerns or getting anxious or getting upset, and I hear staff say, why don't you go pick one of your coping skills to use right now? I mean, guys, come on. If you were upset and somebody said that to you, what would you do? Punch them. Shut up. You go use the coping skill. Right? Don't say stuff like that. Say, hey, is there something I can do to help you out? Why don't we go? And you yourself use their coping skill. You want to go for a walk? Hang out for a little bit? Should we go to your room and just talk for a while? Or do you want to be left alone? Right? And I'll say, hey, why don't you go use a coping skill? I wouldn't take that very well. Okay. Another big one is social skills. Social skills, relationships, all that online stuff we deal with every day. How do we teach some of those things? By the way, there's no right or wrong answer. There aren't answers to these things. Okay. This is what we're just brainstorming and learning together here. But those are some of the big things right now that we have to be teaching people. Relationships, online, dating. How do we teach some of those things? Yeah.
When we go grocery shopping, I let them push the cart. And if he says, Happy Mother's Day to everybody that walks by, I let him say it.
Yeah, not hurting anybody.
No.
Yeah.
You know?
Good. What else? Yeah.
With online, like meeting people or was teaching them the appropriate information to share with people online. What is appropriate and inappropriate conversations, and maybe just kind of teaching them what to look for, like if they're asking for money, just educating them on just
Yeah.
With my, role playing.
Role playing is great. That's a good one. Yep. How many of you have written social stories or used social stories before? Social stories, role playing, doing different scenarios. Those are all extremely helpful for people. And you're going to have to do it over and over and over and over again. The one thing that bothers me though, is for all this online stuff, we can teach how to be safe and how to use all that stuff online all we want, but why are people really doing that?
Natural support.
They're lonely, they want a relationship. How many people that you work with have have someone in their lives they have an intimate relationship with, or someone who they feel really close to, or someone that they really trust? And if they don't, then what happens? I'm gonna go find it somewhere, right? So, and I know a lot of times, and for good reason, nobody's trying to do anything bad or do any harm. For a good reason, we put restrictions in place sometimes surrounding those things, right? Because that is scary. People can get seriously injured. People can disappear. People can all kinds of bad things, right? But what are we missing?
right? What are they really wanting? How do we help them get that in a safe, healthy way, right? How do we help facilitate some type of online relationship or any relationship whatsoever in a safe and healthy way versus just blocking it, saying, nope, can't do that, we're done. That need doesn't go away, right? It's still there. Yeah.
So we have a member who she likes to watch those romantic movies. So once she sees that, she wants to kind of get into a relationship. And so she has access, she has a cell phone, so she has access to the internet. And so what she was doing was signing up for these dating websites. And I guess someone had sent her an inappropriate picture. We didn't know that she was on it. So someone sent her an inappropriate picture and she came and informed us and showed us the picture. And so from that moment, then we started to try to educate. And then we asked her, well, why are you? You know, why did you want someone online? And she just wanted a boyfriend. And so what did we then suggested maybe incorporating her in different activities where she could mingle with people that are kind of local. So I think the people that she were interacting with were out of state. So we were just like, well, how about we offered her different alternatives to a safer outcome, I guess.
Perfect.
And just trying to educate her more on like internet safety.
Good. The whole dating, relationships, hanging out with people in your community, all of those things are really hard, right? Because a lot of those things just don't, I mean, are the people that you're working with doing what other people their age would be doing right now in their communities?
No.
No. Should they be?
Yeah.
Yeah. Yep. So what is the barrier to that? Why are they not doing those things? And how do we get them out there doing those things? Right? So I guess this whole, like I said, we could talk teaching skills we're just barely touching the surface of teaching people skills. And especially for adults in the community, there's not a lot of, we have structured programs, assessments for teaching skills to children all day long. That is, again, one of those things for adults that we lack are very structured teaching mechanisms and assessments and things for adults to teach some of those skills. So I think it takes us working together and learning from each other to be able to do that for a lot of people. So I think part of the point is just make sure we're not just restricting people to try to keep people safe, which we're going to talk more about in a little bit, and not actually teaching the skills for people to still get the same outcome in a safe manner. Make sense? Okay. So when you put any type of teaching strategy in place, any type of behavior support plan. Sorry, go back a second. I forgot about the good news. That's pretty good. Isn't that true? How's obedience training home? The kids train us totally. Pretty good. Scream, here comes mom. Okay. When you put a behavior support plan in place, or you start to teach someone a new skill, you're going to see the behaviors increase. Okay. It's called an extinction burst because I'm gonna go back to hitting you again. I mean, not really. If I'm used to getting his attention every time I hit her, and now he's not giving me that attention, in theory, I'm gonna think, dude, what's up? And I'm gonna up the ante, right? It's gonna get worse. I'm gonna try harder to get whatever it is that I wanted to get his response to me. So you're trying to teach a new skill, but I'm not quite understanding yet, hey, this new skill will get me the same thing. You're not responding any longer to what I used to do to get that thing. So I'm gonna try harder. So you're gonna see behaviors go up. Every single time you introduce a new behavior plan and start teaching new strategies, you're going to see the behavior increase. I have people call me and say, Stacy, this isn't working. They're out of control. Good, it is working. It's perfect. Keep doing what you're doing. Right? Because you are attempting to break the connection of me hitting you for attention and creating the connection of asking you for attention. So you're going to have that period of time where you're going to have increased behaviors. There are also going to be periods of time where people just have a hard time, right? Holidays are hard for people. changes in seasons are hard for people. Families are, all of those things are going to create hard times for people. So as we talked about before, even with the best behavior plans in place, you're going to need to understand and know how to work with somebody when they are having a crisis. Okay. So we're only going to touch briefly on that here, talking about managing crisis situations. How many of you in here actually do something as far as CPI, MAT, PIA, safety care, something? That's not very many. Nothing? Can we put that on a note for a competency-based training somehow?
We just did a
That's-
crisis intervention MANT training, but it's not sanctioned by MANT. They just use MANT philosophies for de-escalation, like you were talking about earlier.
Yeah. How many of you have people who hit, kick, bite, punch, hurt other people, hurt you? Okay, you guys need that training. You need that training. Okay.
So we
anyway.
have 2 online that said yes. One said they do MANT, and then a couple of others just said yes, they have it.
All right, good. Okay. You guys are gonna have crisis situations, right? And especially as we continue to move people from institutions into the community, our population has changed over the years. We have people who now have a lot more abilities and skills and a lot more mental health diagnoses, right? A lot more psychiatric type struggles, and we have a lot more crises. We're not working with people anymore who maybe have Down syndrome or who have a physical disability or who, I mean, we're talking about people who have some significant co-occurring challenges and people with some mental health concerns. So you have to be prepared to manage crisis situations. All right. I think that's pretty funny. That's what I feel like most days. Okay, you can go ahead and go to the next one. Okay, so when we're talking about managing crisis situations, when somebody is in a crisis is not the time that you're going to teach new skills. Okay? Not going to happen. When somebody is in a crisis and starts to fall down this curve, your only job and your only responsibility is to get them back up to that 0. Because at that 0 is where you're going to teach skills, right? I hear people tell me, I have people tell me a lot, when someone is in a crisis and they start coming down that curve, and I'm telling them, well, if they want this, we just need to get them back to baseline. Well, then they're going to learn that A, B, and C. No. People don't learn new skills when they're stressed out and in that situation. You might inadvertently reinforce something you don't want to reinforce. So let's say that, I don't know, somebody give me an example. A really bad crisis. You've had a really bad crisis before? And you're down this line? Yeah. Okay. Do you want a cookie? I mean, we're discussing that example. When someone's coming down this curve and they're having a really hard time, a really challenging time, you maybe just give them what it is that they're trying to get, right? To get them back to that baseline. That's okay. It's okay. Because if you get them back to that baseline and you go back to teaching skills, that is where the learning is going to occur. What happens is the problem that we run into is people give the person what they want down here, they go back to baseline and say, forget it. Crisis is over. Yay, we're moving on, and don't teach any skills. Right? Make sense? You guys are looking confused. I think the Indian food maybe did something to my brain at lunchtime.
Upside down. And
What's that?
I guess I'm used to seeing like the bell
Yep.
curve actually being
Mhm.
upside down.
Yep.
So that's why I'm.
And
confused, like-
you can flip it either way. So what we're talking about here, let me give you, what we're talking about here is when you start to get stressed, you start to lose skills. Okay. So let me tell you a story of a time when I lost all my skills. I had no skills whatsoever. Oh, huh? Yes, no, it wasn't a thunderstorm. It was actually, okay. So there's a reason I moved out of my house when I turned 18 years old. Okay. Moved away from home, moved a couple hours away and living my life, whatever. Well, my parents at one point in time, my dad had a hip replacement done. Okay. And so he was needing people to help take care of him, blah, 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 whatever. Well, for whatever ridiculous reason, my mom decided to have a full hysterectomy not long after my dad had had a full hip replacement done. Okay, guys, great planning, right? Who's taking care of who here, right? So they realize that they've gotten themselves in a position where they can't really take care of each other. They don't know what to do. My sister's an accountant. She's not a people person. My brother's an idiot, really, for real. Don't call him. That would just be bad. And so who do they call to come take care of them? The social worker, the Stacy. Let's call Stacy. She'll do it. Okay. So at the time, my children were really young, and I hadn't been away from them for a significant amount of time. And I agreed to go 2 hours away from my children to go stay with my parents for a week to take care of them. Okay. Where do you think I went up here? Just that scenario, thinking about it right there. Starting to come down this curve a little bit and starting to get a little bit stressed, right? So we start off not even a baseline. I'm on my way to my parents. So I get to my parents and things are going okay. And my dad has a doctor's appointment. So I get my dad in the van and we drive to his doctor's appointment. And in his appointment, we find out that he has a blood clot from here clear down past his knee. I'm not a nurse. I'm not a medical anything, but all I hear, I'm thinking that is really bad, really, really bad, right? So where do you think I went? Oh, I'm not down here yet. It gets better. I'm not there yet. I'm coming down a little further, right? So they immediately say they are admitting him to ICU. And so I get him in his wheelchair and I take him to ICU and we start getting him in the bed and I'm really worried. I mean, I'm really worried that part of this thing's gonna break off and like, I don't know, lodge in his heart or his head or something, and that's it. So as I'm getting him in bed in the ICU, my phone rings. And it is my aunt, who I had called to go stay with my mom at home, who had just had the full hysterectomy, and said, "Where are you at? What are you doing?" And so I tried explaining to her what was going on. She said, "You have to get back here right now. Your mom's in horrible pain. The doctor said to bring her in." What? Fall down a little further, right? Well, I live in a really small town and my parents lived half an hour away from the hospital. So I'm at the hospital with my dad in the ICU, my aunt screaming at me to come home with a van because she can't get into my aunt's car, which my aunt had this little sports car. Great idea. So I needed to go home and get her. So I hung up the phone and started explaining to my dad, here's what's going on. I will be right back. I have to go get mom. Things are not good. I'm coming further down again, right? At this point, I think both of my parents are dying on my watch that day. It was going to be terrible. So I explained to my dad what's happening. I grabbed the wheelchair. I turn around. I go running down the hallway and I get to the elevator and it says out of order. Going down a little further. We're still not at the bottom yet, guys. We're getting there. So here's we talk about losing some skills. So I turn around, there's a nurse's station behind me, and I turn around and I say, "How long is this thing gonna be out of order?" Like the nurse knows, the nurse stays like. So they're like, "I don't know." I'm like, "Well, is there another elevator on this floor?" "No, there's not." "Okay, fine. Here's the stairwell. We're on the 3rd floor. Here we go. Thump, 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 all the way down to the bottom, 3 flights of stairs with this wheelchair. I get to the bottom of the stairs and open the door and realize I am completely and totally lost. I have no idea where my dad's van is. I have no idea where I'm at. I don't know how to find his van, how to get home to pick up my mom. I am completely lost. That's where I hit rock bottom and stood there blubbering like an idiot in the middle of this hallway in a hospital. Done, completely lost it. And some man comes out of the door down the hallway. And if I was him, I would have said, "Oh, geez," and I would have ran the other way and told 911 or something, thinking I don't know, something. But he didn't. He came up to me and he's like, "Can I help you?" And I'm like, "I don't tell me, my parents are dying." And I kind of was probably. And so he very calmly said, "Do you remember what direction you came in from?" Because we had gone from the doctor's office to the ICU, right? Small town hospital, doctors, they're all connected. And he walked me through exactly where we've been, how he came in. He found my dad's van for me, walked me straight to the van, folded up the wheelchair and put it in the van for me and sent me on my way. Where do you think I went? Back. I started going back up, right? Our responses to the people that we work with are going to determine if somebody is going straight down here, but how we respond, or if we're gonna bring people back up to that zero, back up to that baseline by our responses. Had he looked at me and turned the other way and thought, "Ooh, I'm not going down there," I'd probably still be standing in the middle of that hallway bawling right now. This was years ago. So he sent me on my way home, and the kicker of the whole thing is I never had to take that stupid wheelchair to begin with. Right?
I was gonna ask, and I was like, oh, you must have owned it, so I just, so on top of it, you stole the
No,
wheelchair.
on top of it, I sold the wheelchair. Sure did. Sure did.
As soon as you said everything downstairs, I was like, why? But I was like, maybe it's hers, she owns it, I don't.
Yeah, no. Lack of skills. Right? Lack of skills. When people in crisis, we gotta have some patience, man. They're gonna lose skills. And I know it's easy for us to think, I've heard it, I've said it, that they know better. Right? Heard that, seen that? Well, they know better. Okay, fine, who cares? Who cares? Maybe they do know better, but not at that moment, they don't. Not at that moment, they can't do anything differently, right? How many of you have been in a crisis before and did something stupid that you wish you hadn't done? Thrown something, kicked something, hit something, whatever. Said something. You knew better, right? And what if somebody said to you, knock it off, you know better, stop it? Woo, what would you have done then? I hit him again. You hit somebody? Who said that? You gotta hit him again. That's great. What did you need in that moment? Reassurance, compassion. What else?
Somebody to solve the problem.
Solve the problem for me. What else?
Patience.
Patience. What else?
With kindness.
Kindness.
A hug.
A hug.
Yeah.
Maybe left alone, right?
Yeah,
Some people need a hug, some people leave me alone, right? What if what if someone responded to you in the same manner that typically we respond to people that we work with who are in a crisis? How do we respond to people in crisis? In what way?
Maybe speaking to an adult individual the way that we would speak to a child, like as though they don't understand or don't comprehend.
Yep. Condescending. How else?
Quick to put hands on it.
Yeah, definitely. Think about that. Somebody put hands on you in that moment that you were doing whatever. What else? Dismiss them sometimes. Say, go use a coping skill. Don't do it, telling you.
Sometimes solve it for them or give in to whatever it is.
Which is
depending on
fine.
the
Yeah,
situation.
yeah, sure.
Yeah.
Yeah. Sometimes we say, don't forget your programs you're working on. Your goals and objectives, whatever. Who cares about those at that time, right? Nobody cares. Somebody's gonna say something.
I said remain calm.
We should remain calm, absolutely. Is that what we do?
No.
If somebody else is in a crisis or you're in a crisis.
If someone else is in a crisis, what are some of the things that we do that maybe we would not want done if we were the one in a crisis?
Say, I know how you feel.
I know how
Somebody
you
online.
feel. No, you don't. You do not. You're not me. Antagonizing. Yeah.
Offer a story you think is worse than what we're dealing with right now.
Yeah. Well, I went up here. Yeah.
Say it about yourself instead of that person who's in crisis.
Yep, absolutely.
Or say something like, you don't want to go back to jail.
Right, I know, oh my God. Oh, or the hospital, or the institution. You're gonna lose your placement, or I'm gonna call your mom. Oh my gosh, don't do that stuff. But we do it, right? Why? You guys were just able to sit here and tell me and explain a time when you were in that place and what you needed from somebody else at that time.
When we responded to
But
somebody that way.
yeah, so, I mean, you guys know, right? But then we talk about somebody we provide services to in that same type of situation. And we do the complete opposite. Not viewed as adults, not viewed as equal, not viewed as, right? We are not an authoritative figure over the people you work with. You're not. You're not their parent, you're not their boss, you're not their rule maker, you're none of those things. You are there to help that person live the life that they want to live, how they want to live it, right? Yes, do people have rules and responsibilities and all of those things that all of us have? Absolutely. But they don't have, they shouldn't have more than what we have, right? It's, that just goes to how we view and we think about the people we provide services differently from ourselves and how we put them in a category separate from ourselves. That right there can contribute to behaviors. They're not living the life that their peers are living in their communities, right? And I think it's a very valid question of why not? Why aren't they? Okay, so just one more thing about this is when we're talking about coming down that curve and starting to lose skills. You remember we talked about before, my behavior affects yours and your behavior affects me, right? Whatever you do in that moment is gonna decide, are you pushing this person clear down here? Or are you gonna bring them back to that baseline? After they're back at that baseline, after they've decompressed, gone through that transition period, then you go back to teaching skills, not while they're in a crisis. Okay. Just a couple more things about managing crises is don't take it personally. How many of you have been in a crisis situation before where you took it personal? How'd that work out for you? Not well. What happened?
Increase the behavior.
Increase.
Yep. My mood would decline and it doesn't help bring theirs back up.
Exactly. Because your behavior is going to affect
Right.
theirs, right? You can't take it personally. It may or may not have anything to do with you. You think about everything we talked about this morning, about a person's life history, about systemic issues that the people we work with have to deal with, roommates, meds, guardians, payees, all of those things. It's not about you. You can't take it personally. The second you take it personally is the second that you are now not professional. You are going to do something that's going to escalate the behavior versus bring that person back to that baseline. Okay. Being supportive and collaborative versus authoritative. Like I said before, we are not the boss of the people you're working with. You're not. You don't make the rules. You're not in control of their lives. You are there kind of as like a life coach to help them learn skills and live how they want to live. Okay. So there isn't that really, if you think about teaching skills and you think about how people's lack of communication and lack of skills, you're a coach, right? Think about being a coach. You're not an authoritative figure. Acceptance is different than approval. I heard this quote a really long time ago. I don't even remember from where, but it was something that really stuck with me because I have to accept what is going on in the moment that it's happening. If I'm working with someone, I try to remember this a lot when I'm working with my son. And if he's having a crisis, I don't approve of what he's doing. I don't approve of him breaking things. I don't approve of him trying to hit me. I don't approve of those things, but I have to accept it at that point in time because that's what's happening in that point in time, right? So by just accepting that that's what's happening, kind of giving up, you're not controlling it, you're accepting it, right? It's what it is, it's what's happening. Can help you deal with it oftentimes without becoming authoritative and going down that path of ending up in a power struggle and making things worse. That makes sense? Okay, we're gonna watch another video.
Oh, good girl. Oh, Easy now. That's a good girl. You're all right. You're okay. I'm just going to take that line off now, and you'll notice that my pulse rate is not up a tick. I don't care if she wants to buck. That's to be expected. It's all right. I just want to be sure this saddle will ride her. And if it's the first saddle of her life, and it is, she ought to buck with it. Okay. So, I want to be out here now and just be her friend. Be her friend and be here for her. Okay. We belly over at first. And I just want her to carry his weight. He could jump back out of there if she decided that she wanted to take a jump. But it's amazing when you get their confidence that the joined up horse looks up at his first rider, not as an adversary, but as a partner. And certainly with a lot less fear and consternation than the horse who's been started by using the tactics conventional, which are by their very nature adversarial.
Okay, what did you hear? In relation to what we've been talking about.
You need to let them know that you're their friend.
You're their friend. There to be his friend. What else? Build trust. Absolutely.
Expecting negative behavior.
Expecting, yeah, crisis, expecting things to go wrong. Things are gonna happen.
I was gonna say acceptance.
Acceptance, good. What else?
Patience.
Patience. Keep going. What is?
The step-by-step process, so.
Yeah,
Trust and confidence from online from Amber.
yep. Good. What else?
I think it was a time for the behaviors go, like it allowed him the time for the horse to express wherever the uncomfortability or wherever the behavior was, he allowed it until it was a little calm or comfortable.
Absolutely. I love that. He did. He took the time, was patient and calm and just allowed it to happen. It is what it is, right? We have to accept what's happening. His heart rate didn't raise a tick. Hear that? I don't know about you guys, but I've been in some pretty stressful crisis situations. And I can tell you that on the inside, a lot of times your heart is pounding. You are like, oh my gosh, this is really bad. But on the outside, you need to do everything humanly possible to stay calm, to be confident, to be in control, right, of your own behavior. Because guaranteed that person, if you're not, that person's going to pick up on it. Absolutely.
Baby steps, like, you know, like you said, patience, but like, doing like little, I'm not expecting like instant, trust or whatever, like, really not.
Right.
Right.
Yeah.
You seemed every time you approached the horse too, it was always a touch. So it was just building that, you know, I'm not gonna hurt you, but that, the trust between the
Yep.
two.
And that connection.
Yeah,
Yep.
and the
Absolutely.
consistency.
Yep. Sorry, what did I mess up?
No big deal. I got it. It took me a second.
People are gonna, a lot of times, not a lot of times, there are some people that when they're in a crisis, they need to know that you're in control. They need to know that you are there and you have things under control and you're gonna help them and you're gonna support them and you are a safe person, right? So if you're out of control, they're gonna become even more out of control, right? Not a good idea. The other thing that I really like about what he said is at the very end, where he says the horse that has been, something about traditional or conventional tactics, which are by their very nature adversarial. Something about conventional tactics being adversarial. Think about what we talked about this morning. Traditional discipline versus positive behavioral supports. We're just slow to the game, guys. Traditional discipline is very, is very adversarial, right? We are in control. We are calling the shots. We are talking about punishment and we are punishing, right? Versus what we're trying to do now, which is to help people live the lives they want to live and being a partner and helping them learn skills to be able to get where they want to be. Does that make sense? Okay, any questions about that? No, everybody good? All right. Okay, sorry, we were talking about the next slide. So clearly knowing what to do in a crisis decreases staff fear and anxiety, which we just talked about, also decreases injuries and ultimately decreases staff turnover. We talked about that this morning. You're gonna have a really hard time stabilizing behaviors if you have a constant staff turnover. There's not gonna be any consistency. So whatever you can attempt to do to get that consistency is for the better. Go ahead. So like we already talked about, these are just some various options. I don't care what people choose to use, but ensuring that you have something if you're working with someone that has really challenging behaviors so that you can keep yourself, roommates, everybody else around you safe. Okay. We are doing good on time. Does anybody need a quick break since it's like that after lunch? Some people are like, no, just go. After that lunchtime, or you want to just keep going and get done early, or what do you guys think?
I love the early idea.
Yeah, early idea. All right, let's do it. Okay. Encouraging desirable behavior. First of all, if we have our needs met and we have what we want in our lives, is there really any need to have behaviors? No. No. So how about that? How about we just strive for that, right? Go ahead. Do any of you ever feel like this? Oh, where's it sit?
How come I never get caught doing?
Yeah, how come I
Not
never get
being
caught
good.
doing anything good? That's true. People usually don't get caught doing good things. People get caught doing the things we don't want them to do. Go ahead. Okay, so we tend to focus on problem behavior. What if we focused on supporting someone that helps them enjoy a quality of life that makes problem behavior unnecessary or irrelevant? Go ahead again. So when we think about this, I think about a couple different things. For one is we have just like everyday preferences that all of us have, right? A lot of times it's the little things that really matter the most to us. So some of those preferences as far as food, what preferences do the people that you work with, what preference for food, drinks, activities, not riding around in a van is not an outing. Oh, that's another trigger for me. First of all, if someone gets excited about going on a van ride to get a pop, there's something seriously wrong with that. Think about that. If that's the only thing you had to look forward to in life, I said that's pretty sad, guys. Okay. Do you guys know what the preferences are for the people that you work with? I mean, I know people that I've consulted with and worked with, they like McDonald's and they like pop. Come on. Are we letting people experience different things out there, right? Are we taking people out to just explore what some of the different possibilities are as far as different types of foods, different types of drinks, different types of activities? Everybody's different, right? Our communities have a lot to offer in a lot of different areas. I think about, we have kind of this, we have success for people with disabilities over here. And then we have success that we would look at as far as you and I go. And they're not the same thing, right? Success for a person with a disability, I think about things like, okay, they live in an HCBS home, they have a couple of roommates, the room's decorated how they want. They get to go out on an outing twice a week. I'll come back to that trigger in a minute. They get to go out on an outing twice a week. They get to order in food once a week. And the activities that they do is go to fast food, they go bowling, and they go to the day program. What's about it? Van ride, thank you, and the van ride. To no destination, just a van ride. What the heck is that?
Oh, these guys.
Not with these, exactly. Your bosses are gonna kill you if you keep doing that. Is that sound like success to you in your mind, in your world? Or is that just success to this person who has a disability? That is not success in my mind, my world, absolutely not. What are you guys doing? The only thing you guys are doing is going to McDonald's in the van ride to get a pop? Bet you not. Work that makes you feel meaningful. Perfect. We don't have a lot of people. I mean, the work situation is just hard, really hard. What else? Vacations. Are people planning vacations? Not you guys, but you know, well, I am, but people that you work with, are they planning vacations? Do they have something to look forward to? Have they ever tried Indian food? Woo! Don't take them there if they don't like spicy stuff. Stacy's gonna need a cheeseburger on the way home. I'm just kidding. I'll take you with me, dude. What are we doing? Have they tried different things? Go to different restaurants, go to different activities, go to different, or are we stuck in this is what we know and this is what we are comfortable with, so this is what we are going to do? Right? Those are what I think about. What is any other person, the age of the person you're working with, and the community that they live in doing right now? Are they going to bars? Are they going dancing? Are they going to a movie? Are they, I don't know, what are they doing? And then are the people that you work with, are they doing the same things?
We have a question online.
Some
How-
maybe? Yeah.
How do you keep this in balance with routine and schedule that makes them comfortable? How do you connect those two
That's a
things?
good question. We do have some people who are very rigid with schedules, very rigid with routines. Guess who got in a lot of situations, guess who created that rigidity? Mhm. We created it and it works for the person now, but now we're stuck with, oh no, COVID hit, their routine is screwed up, now what? Ooh, that was bad. For a lot of people, that was bad, right? It's gonna take time. It's gonna take time building in that flexibility. It's gonna take time making minor little changes in the schedule, minor little changes in the routine, letting the person know ahead of time that that minor little change is gonna come. And starting there and just working towards trying to get that person to be able to be a little more flexible. I have people say a lot, well, they don't want to do anything else. This is all they want to do. We ask them if they want to do this and they say no. Okay, well, if you were asked to do something that you've never done before, you didn't know what it meant, you didn't even know what the person was talking about, and you have anxiety and trust issues, what's the easiest thing to do?
Say no.
No, I'm staying home right here where I got my video game and my TV. I'm not going out there, right? So we're not just taking no for an answer. What can we do to help people be more comfortable to actually get out there and do things? They probably have no idea. You know why people like van rides and pops? Is because that's what they did in the institution. They got to go on a van ride. Woohoo! That's all they know. Right?
Pictures of maybe where you're gonna go.
Perfect.
Yeah, we have social story on here.
Social story, show them pictures of where they might be going, right?
I like YouTube videos that show like people having that experience.
Absolutely. Making sure the person has an out. But if we just go try it out, and if at any point in time you want to leave and you're uncomfortable, we're out. We'll leave. Give them an out, right? But don't just say, hey, you want to go to the water park? No, okay. Do you even know what a water park is? I mean, they're pretty fun, by the way. I like water. Does that make sense? How do we help people be more comfortable? Because the easy answer is gonna say no.
I think sometimes we don't. I had an individual, I literally had a conversation and we just we discussed the difference between living and existing.
Oh,
And so.
absolutely.
And sometimes we don't think that they'll understand that they not only got it, they were like, let's try new things. I'm gonna live. And I was like, all right. I'm
Yeah.
going to staff to take you.
I love that. That's great.
I want to go too. And so
Yeah.
I think I sometimes challenge us to have courageous conversations beyond what we think their capacity is.
Absolutely, absolutely. And we're gonna talk about the capacity and our ability,
Because often that's placed on them by us.
absolutely, which, see, you guys have the perfect segues.
Well,
Yeah, thank you. Go ahead and go to the next slide.
I just wanted to ask a quick question about this slide, because I was looking at the choice assessment. thing.
Oh, yeah.
And this might be too far down. What do we do for like, I have a lot of individuals on my caseload that I'm creating behavior plans for who are in like an RCF or
Mhm.
PMI unit. What does that look like for me to go in and say, like, even when we're trying to look at like distractions for like in the safety film, like let's distract from this moment to develop new me activities or go through new skills. But there's these restrictions in place
I
and
know.
the things that they do, like, for example, one of my individuals wants to have a cigarette, but the payee says, no, 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 we don't want you to smoke. You don't get money for cigarettes. Where do we go?
That got the reaction. I got.
Sorry, payee is also the guardian.
As a former smoker, I'd be like,
So my
that's
question
funny.
is, how do we, because this could be a very triggering conversation, but it's helpful for me to know for the behavior plan. But if everything that comes up that is a
I know.
choice that would be helpful is not available or not made available or is a restriction, how do we navigate something like this?
It's hard. And what I can tell you is that it takes education, 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 education.
Right.
And like you guys here, I mean, educating parents and guardians, educating payees, I mean, and guardianship, I'm sorry, is not an end all be all. Guardianship does not control everything, right?
Yeah.
Does not control a person's life. Now, I'm not saying that you should go against what a guardian's wishes are because you have to maintain a relationship with them, right?
Right.
But you can try to help educate them.
So you have to advocate for the person.
Advocating for the person that you're, yeah, absolutely. Absolutely. There are also, so we're going to talk in a little bit about, it's not in here either, is it? Silly rules. Okay.
We have a
There are
question from
certain-
online that kind of goes with that too.
What's that?
We have a question in this, on the
Okay,
same
all
line.
right. There are certain regulations that people have to follow, that we have to follow, right? There's federal regulations, there's state regulations, there's certain things MCOs say we got to do. There's certain things that different regions or counties say we have to do. So we have to follow those things. I'm not telling you guys to just go out and break all the rules, right? We have to follow some of those things. However, question, is this real? Does it make sense? Do we have to follow this? What does this look like for this person? How can we think outside the box, right? To think differently about those things. But there's not an easy answer for that. It is mostly educating.
I just want to bring you with me then.
Stacy said.
Stacy said, no, we don't use Stacy said.
Let me get some of your cards.
No. I don't have any.
So Molly online asked, and I'm sure a lot of you can relate, financial limitation. How do you overcome some of those and still take the person out and experience the things that we were just talking about?
It's hard. I mean, this is becoming hard for everybody in a room full of social workers, right? I mean, what's happening in the world right now? It's hard for everybody. You gotta be creative. It's the only thing I can think of is try to be creative. Can the person work to earn some money? One, any kind of job. What did you say?
Rent reimbursement.
Rent reimbursement to increase the
Mhm.
amount of dollars you can spend towards fun stuff.
Yeah, yeah.
Subsidies.
Subsidies, food stamp guards. Can you get a job?
Is there a
any
garden
type
around you, a
donations?
zoo?
What's that?
Is there a garden around you, a zoo, things you can do that are not. that
You
don't
know,
cost?
and in a lot of places, if you just call them up and tell them the situation, sometimes they'll do a donation, they'll do whatever.
Yeah.
So don't be afraid to ask.
Yeah, sometimes, like, I find a lot of free stuff that not other people know about. There's a lot of free stuff out there. for them to get involved in. It takes kind of going that extra mile that sometimes we don't have the time to do, but
I know, yeah, yeah.
it's out there.
Yeah, for those of you online, she just said it's hard to find the time to be able to do that. There's a lot of free things that are out there, but it takes time to research all of those things. You know, I wonder if there's like a Facebook, I'm asking this as the, you know, training specialist too, but is there like a Facebook group for free stuff in your area? Like, have any of
The
you-
public library has been a great resource for me.
Okay.
And that's just in my own personal life too, like this summer, I've got all these kids, I don't want them in my house, they need to go somewhere. And you go to the public library and they have it divided out by age appropriate activities, and it spells out like, you can pop up for this one, or you can sign up in advance, and like all of it's been free. So I feel, and there's adult activities there too, so I feel like public library is a good choice.
Sometimes just Googling, like I Google a lot, so like I'll Google like free or low cost activities going on in Cedar Rapids, Iowa. And then you can find like even like little concerts or little things.
She
going
Googles
on
free
that
things to do.
things to do.
Or the events in Facebook
Yeah,
too.
so that was-
The event section
Oh,
of Facebook, you can divide it out by local, and it'll show you everything that's happening this week and if there's a cost associated.
Wow.
There's Facebook groups for DSPs.
Really?
Or people in this field. There's Facebook groups where you can get involved or join the group or whatever. And a lot of times there's activities that people post on there, like all over Iowa. So not just here locally, but all over
That's
Iowa.
awesome.
That is awesome.
See, we all learn things together. That's awesome.
Like one of my favorite places to take people is Pikes Peak. And it's free and it's awesome. Like there's tons of stuff to do. Pharmacopeia or, you know, like things like that.
Yeah, that's awesome. Cool. Now I completely until I forget what we were talking about because it was just
Realizing hopes and dreams and wishes.
hopes and dreams and
And
wishes.
fulfilling
Yeah,
them.
okay, so besides just personal preferences and what you're referring to, there's a preference assessment in your binders that, you know, you can use if you want. I don't do a lot of preference assessments. Just it feels too formal to me. I like to just, you know, for you guys, what's great is just go hang out with people and see what their reactions are. Let them try a million different kinds of foods and drinks and activities and whatever you can think about and watch their reactions. Do they like it? Do they not like it? But then the kicker is make sure you pass that along to your colleagues. Write it down somewhere so the next staff coming in knows that that person likes that, right? But aside from just those everyday type preferences, people still have hopes and dreams and wishes, right? You guys have hopes and dreams and wishes? Or are you where you're at right now and you want to be the rest of your life? Absolutely not. The people you work with do too. They have hopes and dreams and wishes, right? How often, however, do we squash people's hopes and dreams and wishes? All the time. Have you ever had someone tell you that they wanted to do something and you're like, yeah, no, that's not gonna happen? That's what you're thinking. Or maybe what you said to the person, right? So when I was, you know, young, starting out in this field, and I thought actually I had a clue and I knew what I was doing. I did hourly services, so I worked with this guy. Just going in and seeing him in his own apartment, helping him with budgeting, sometimes shopping, sometimes whatever. He told me one day that his goal and his dream was to learn to drive a semi. Oh my gosh, okay. Semi. In my head, I'm thinking, that is a terrible idea. That's gonna be tragic. Somebody's gonna die. I didn't say that. I said, oh, okay, well, have you ever been in a semi? Nope. Have you ever been on a farm, or have you ever been up close to a semi, or ever, you know, do you know anything that they can do? Nope. All right, well, so we kind of moved on from that conversation. So me thinking I'm smart, I lived in a very small town. It was like one of my first jobs. And I'm like, you know what? I have some friends who are farmers. I'm going to see if they'll let me bring this guy out so he can actually come see the semi. Once he sees that semi and realizes, holy cow, how big it is, he's going to realize I'm not driving that thing, right? So call up my friend. He says, that's fine. Come on out. So we go out. And we get out there and he sees the semi and he's like, oh, wow, that's really cool. That's huge. And I'm like, yeah, no, it is, isn't it? Really big. Think you can drive that thing? Oh, yeah, I can drive that thing. What have you done? So my friend offered to let him crawl up, and into the cab, and he's sitting up there. And he is beaming from ear to ear, and he's on cloud nine. And I'm like, I am going to be fired. Just started in this field. Clearly I'm failing. I'm out. So we go back to town, and he is just talking about this thing, and that's the coolest thing in the world. And we get back, I'm like, you still think you want to drive that thing? He's like, yep. So I did, I tried to do all the convincing, right? Dude, I don't think I could drive that thing. That's going to be really hard. And you have to pass this test, and you got to do all these things. Trying to talk him out of it, right? Because that's what we do. You guys been in that position? Yeah. That's what we do. We'll stop right there a second. Remind me where I was at. Stop right there a second. Who are we to tell anybody else what their full potential is? We're not. We can't tell anybody else what their full potential is. Sometimes we don't even know ourselves what our own full potential is, right? Have you ever had a really good coach or really good someone who pushed you beyond what you thought you could ever do? So why do we think that we have the knowledge, or we have whatever it is, to tell someone what they're capable of? We don't. People are a lot more capable than what we give people credit for, right? We try to protect people. We don't do that, I don't think, to be mean or to be, we're all here because we're people. We're all here because we care about people. So we don't do these things for bad intentions. I think a lot of times we do it to try to protect people, to keep people from being disappointed. But you know what? A lot of times what we're doing is just keeping people from a lot of opportunities. So I said to this guy, like, all right, so you still think you want to drive that thing? Yep, that's what I want to do. That's what I'm going to do. It's going to be my job. I'm going to drive somewhere. So still thinking I'm smart, I called my friend back up and I said, hey, can I bring him back out? And he really hates loud noises, and riding in a semi would be really, really bumpy and rough. Will you take him for a really long ride in a semi? I don't even think he's been in one. Never ridden one. Yeah, come on out. Okay, great. So I tell him we're going out. He's like, oh my God, he's so excited. He crawls up in there and they take off and they're gone for half hour, 45 minutes. And I'm thinking, this is totally going to do the trick. He's going to say, no way, I'm not going to do that. That's too much. That's too hard. They come back. He gets out. He's grinning from ear to ear. Stacey is for sure losing her job now.
Did he come perform?
Oh yeah, he was doing all of the above. He was having the time of his life. And I'm convinced that I've got to find another profession because it's not working out for me. So we get in the car and we head back to town. I'm like, what'd you think of that? He's like, that was the coolest thing ever. I'm like, all right. So you think then what's the next step? I guess you have to take a test. You got to pass the test. Should we just go get the book? You're going to have to start studying for the test to see if you can pass, to see if you can drive a semi. He looks at me and he's like, I could never drive one of those things. What are you talking about? What? He just wanted a ride. That's all he wanted was a ride. That's all he wanted was a ride. I learned a big lesson that day, let me tell you. Had I done what a lot of times we do and said, tried to convince him otherwise, or tell him no, or tell him he couldn't do that, or tell him whatever, we'd still be there arguing about that today, right? Instead of just going with it and saying, all right, great, well, let's do it. Something's going to stop him if it's not safe to do it, right? He either wouldn't have passed the test, or he wouldn't have passed the driving portion, or something would have stopped him, but it wouldn't have been me. Because that's not my job. Not my job to protect him. It's not my job to tell him that he can't do something that he might possibly be capable of. It's my job to support him in getting to whatever point he wants to get to. And if he can't, he can't, right? But a lot of times, like I said, for good reason, we will stop those things or prevent those things from happening because we're trying to take care of people. Which is okay, but that also prevents people from having a lot of opportunities that they otherwise wouldn't have. I mean, think about how you guys learned. How many of you knew what you were doing when you moved out of your parents' home at 18 years old? How many of you, if you had a guardian, would still be living with your parents? Because they'd say, oh no, you can't.
I just want to share something because the story that you just told is exactly what we do in IPR.
Perfect.
That's what an IPR practitioner is. We help them do whatever it is they want to do.
Awesome.
And like you said, the system
We'll
will,
start-
at some point, they'll realize, but also hopefully figure out an alternative. This
Absolutely.
is not good for me, but
Uh-huh.
this I
Yep.
can do.
Does
Yep.
everybody know what IPR is?
I asked it this morning.
Yeah, it's intense psychiatric rehabilitation. That's what the whole process is.
Mhm.
The whole goal is to help them learn about not only whatever they want to do, but what alternatives might be.
Right, right.
So they can figure out what they can do.
Yeah, absolutely. That's perfect. That is perfect. So I don't know how or why I didn't end up here, but usually right before we have this conversation, we talk about silly rules. And we've already kind of mentioned and kind of talked about some of those, silly rules like stopping people from doing things they want to do, but and I can send it out to you guys if you want, and we can put it online and add it to the recording, but we do have a bunch of silly rules that are within our system. And some of those rules are there because they're either federal, state, whatever rules that we have to follow, right? And they're there for a good reason. Sometimes, however, there are rules in place that maybe really don't work for that person, or there are rules in place that maybe we interpret a little bit differently than maybe what they were intended for. Because seriously, you can interpret just about anything any way you want to, right? So I challenge you guys to always ask questions. Always ask questions. I hear people say sometimes, well, we can't put that restriction in place. Why not? Well, because we were told we can't. By who? Show me. Where's it at? Don't just say because you heard from somebody that this is how it is. Ask questions and find out. Well, that's just the way we've always done it. I don't care how you've always done it. Why? Why have you done it that way? Well, because so-and-so said so. Why did so-and-so say so? Show it to me in writing. Agencies have policies and procedures in place, again, for good reason, okay? However, oftentimes those policies and procedures are across the board rules and across the board policies that don't work for everybody. But because maybe one person was allergic to peanut butter at the day program at lunch, now nobody can bring a peanut butter sandwich to lunch. Right? You're laughing. That's true. Very true. Are you told you can't bring a peanut butter sandwich to your lunch? For your job? Maybe you have a coworker that's allergic. Maybe it should be a rule. See what I'm saying? We keep people from learning. We keep people from being responsible. I'm not saying I want somebody to have an allergic reaction to peanut butter. But you get what I'm saying. We make across the board policies instead of teaching, hey, you're allergic to peanut butter. If you see somebody who has peanut butter go sit into the table, or you can't eat the peanut butter, or if it's that serious, I can have somebody with them, right? Say, don't eat that. But what we do is we slap on some of those policies, right? Can't do this because somebody might be allergic, or someone might choke, or whatever it might be. Yeah, you have a question.
Even in like elementary school, I know my kids were in elementary school or when they were in elementary, if you brought a peanut butter sandwich, the person that brought the peanut butter sandwich had to go sit at the.
Yeah. Yep.
So I think that's kind of interesting versus treating the student that is allergic to peanut butter.
Absolutely. Yep. What are some of the other silly rules that are on there that I think about? Or somebody referred to bedtime earlier. A certain bedtime. Do you guys remember that? Somebody said something about a bedtime. Do the people that you work with have a bedtime? They're adults. Oh, I know what it was. It was getting at not being able to sleep in.
Oh, yeah.
Not being able to sleep in. Why can't the people that you work with sleep in? Because they what?
They have their day program.
They have their day
to
program.
have their meds.
Okay. Their routine that they decided, or a routine that we put in place for them? And we put in place for them. Let's talk about the day program thing. Do they want to go to day program?
No, but we need to do that.
Why?
Because we don't have enough staff.
But there's staff at the day program, so.
Yeah, but those are out here at a different ratio.
We can't take police staff for days over
Why?
We could. I know.
there. We can have funding from that, just-
Funding from what I'm told. There it is, right there. Funding from what I'm
Above
told.
my pay grade. He says that's above my pay grade.
Some people don't want to go to day program, guys. Some people want to retire. Some people don't want to be around other people, right? Some people don't want to go to work to these ridiculous jobs that we put them in where they're not making any money and it's just silliness. Right? If you guys don't like your job, what do?
Quit.
Quit and go get a different job,
That's right.
right? Do the people we work with get to do that?
Nope.
Nope.
Sometimes if it's a medication, time situation, if you talk to the doctor, they can adjust the medication times for their schedule.
You guys are just way ahead of me here. Way ahead of me. Absolutely right. That always comes up and people argue with me. So let's talk about that. Medication. Well, so-and-so can't sleep in because I got to take meds in the morning. Okay. How many of you take meds?
Take their meds and go back to sleep.
How many of you take meds in the morning? How many of you wake yourselves up on a Saturday morning to take your meds?
No, go back to sleep.
How many people do you work with who have medications that they have to take on a weekend and you wake them up to take their meds? Oh, come on, be honest.
Yeah,
Uh-huh.
they got
How many
to.
times have you gotten punched doing that? I'm just saying, no. I'm joking. Let's think about that a second. Why is that the case? Why do we do that? You were told to. Okay, why were you told to?
Policies and procedures and safety, like if you
Okay.
don't have the routine and you don't follow it, then there's error of not getting the medication. So sticking to the same routine every day regardless prevents the error.
Okay, all right. What else?
Medication administration procedure.
Medication administration procedure. Which says what and why?
And don't they, if they only have, is it like an hour?
There's an
Hour
hour,
hour,
hour.
yeah,
Mhm.
there's windows.
Where's that time frame come from?
Where did that come from?
Or maybe not right,
Okay,
It might
hold
be a
on.
practice, it might be a practice of policy.
Okay, just hang with me here a second. Okay, so I understand you got an hour before, an hour after, which may be a policy or regulation above an agency level. However, who sets the time that that person is supposed to take that med?
The doctors.
The agency
Who asks
actually
us
sets
for
the
what
time.
The doctor just.
Ours is the pharmacy.
Yep.
What you do is prefer.
You know what sets your time?
So we have pharmacy listed, we have doctor listed, we have agency listed for who sets the time.
Who sets your time is that med sheet that comes from the pharmacy. That says 7, noon, 4, 8, whatever it might say.
Because it's
Right.
based on twice a day, 3 times a day, 4 times a day.
So we have a couple
So-
of comments online. Sometimes
Okay.
medications are timed
Mhm,
as well.
Absolutely.
And then the doctor sets the time with the idea that too late might interfere with the next round of medication sometimes.
Absolutely. So my point is this. Those are set out of convenience or routine, or because that's the way it's always been done for a MAR to be sent to the agency.
Or the assumption of what someone's day.
Or the assumption of what someone's day is gonna look like. Absolutely. It looks the same for every person typically who's on that same type of med schedule. Right? And you just told me, we can print out a MAR for you guys based on what your medication says. And I bet it would be along the same lines of what you guys get from the pharmacy for the people you're providing services to. 7 AM, you got an hour on either side. How would you deal with that? I wouldn't deal very good with that. So I am not suggesting whatsoever, get this recorded, little owl thing. I am not suggesting whatsoever that you commit med errors or that you don't do what you're supposed to do or follow the rules and regulations. I'm not saying that at all. Okay, making that very clear. Pass meds when you were supposed to pass meds. However, if that med time is causing a problem for somebody who wants to sleep in, call the doctor. Hey, we have a schedule for this time and he really wants to sleep in on Saturdays. Can we push it back to this time? Okay. 9 times out of 10, they're gonna say, okay. Yes, there are some medications that you don't have that flexibility with. They're very time sensitive, right? Those medications, sorry, Sorry, that's just how it's gotta be. But that doesn't mean you just stop at the fact that your piece of paper that came from the pharmacy said to give it at this time, because yours would say the same thing. And you don't do it.
Yeah, if you think about it, like people that might work like first shift, you know, they wouldn't have that, like they're not gonna take like a morning med at 8 AM
Mhm.
when they're just getting off work, so if they can make adjustments.
Yep.
Obviously, it would be a pain to make adjustments for everybody that is actually taking, like all of our customers. But if there's one person that's really struggling with it, I feel like it's worth it to reach out. And ask for adjustments.
Yeah. Well, and we're working with people, everybody's different. I mean, everybody's meds are their own meds, or their own times, or their own, you know. And yeah, I mean, people did tell me, well, we wake them up and they take them, they go back to sleep. Okay. I wouldn't be okay with that. And I'm assuming there are some people you guys work with who wouldn't be okay with that, because you wake me up, I'm awake. Then I'm not very happy because I will go, and I'm not gonna go back to sleep.
We have somebody who was rarely home in the mornings at their med test time. And so I just called and asked for it. You can take all this meds in the evening. And he's like, yeah, that's fine. So he only had one med pass a day, which made everything way easier.
I'll bet. Yeah. There aren't, I mean, to my knowledge, I mean, I'm not a psychiatrist or a doctor or whatever, but to my knowledge, there's not a ton of meds out there that are so prescribed that you have to have them exactly at these times. I mean, I get there has to be a period between them if you're taking the same ones, but you push the 7 back to 10 or 11, and then you push the next one back to whatever.
So we have people online that are saying sometimes it's effective to take them at the same time every day, they've been told.
Yep.
And there are, could be meds like that. And then also sometimes they've called the doctor and they aren't able to move them, but for the most part, if they can contact them and adjust, they will.
Perfect. Good. Good. And what are some of the other silly rules I've heard? That's a good one. Best one. Maybe not the best one, but so think about these silly rules that I'm referring to, which we will send all of you guys, are basically written by a woman who lived in a group home. She describes it as a group home, and when she left the group home, she wrote these silly rules. So one of the other things she said was anytime that she wanted to go out on a date with a boyfriend, the staff had to go. So it was like they were double dating all the time. Think about that. If you wanted to go out on a date and your parents had to go with you as an adult, hello, kind of weird. So just make sure that you're always questioning. When you hear something, if it's causing a problem for an individual, ask questions and don't stop asking questions. Because it's the way it's always been, or because that's the rule, or because that's the policy, show me. Where is it a policy? Because just like she said, I mean, all rules and policies are interpreted in a different manner, right? And so just ask the questions, think outside the box. Don't get stuck in because this is the way we've always done it, because we're working with human beings. It's not the way we always do it. Okay. Any questions about anything that we talked about today? Yeah, sorry.
So kind of back on the thing we were talking about, one of the biggest barriers I've seen is where we are and are not allowed to transport them to. Like, or we can transport one person, like let's say to work.
Yeah.
But because it's not somebody else's fault, we can't transport them to work. And like being fair across the board, I mean, individuals are all in the same house. Like, for one, they shouldn't have to understand why we can transport one person and not the other to work. I mean, that's a big barrier that I see all the time.
Yeah. Transportation period is a big barrier for a lot of people. Accessible housing is another big barrier to a lot of people. So become an advocate for the people that you work with, right? For all of those barriers, because there's going to be barriers every place they turn with everything that we talked about today. And the more you can do to try to advocate for that person and overcome those barriers, the better. And just keep thinking about, is anybody else in this community of this age doing right now? And is that what the people that you're working with, is that what they're doing? Right? We are going to end with a couple things. A video that I'm going to show you that kind of speaks to not getting stuck in that kind of disability, quality of life, disability world kind of thing. And then also do something with, there is an evaluation, like we mentioned. Okay, so the video that we're gonna play right now is a video of, some of you may have already seen it before. It's a I'm Tyler. You guys seen the I'm Tyler video? Tyler was an individual from Waterloo who, I guess basically had the typical high school experience of what anybody else would have, having disabilities. And really, it's kind of what we've been talking about is what would anybody else be doing who's this age in this community, in this school? Are they going to baseball games? Are they participating in activities? What are they doing? So we're gonna end with that video. Unfortunately, Tyler recently passed away, which is very, very, very sad. It was really bad. However, he still has the things that he says and what he stood for and the trainings that he did and the influences that he had out there were just amazing. So, yeah.
We appreciate your time and interest in this topic and look forward to seeing you in another training opportunity with Iowa Medicaid. In order to receive a certificate of completion, you must complete the competency quiz in the link here. The survey is optional. Thank you.